Good afternoon, everybody, and welcome to the Education, Children's Social Care Overview and Scrutiny Committee. Before we start these proceedings, may I bring your attention to some housekeeping matters. There is no expected fire alarm today, so if you do hear one, please follow the fire and emergency procedures that are applicable to the Council House. Please can I ask also that you use your microphone when you are speaking and that it's switched off when you are not, and could you please turn your mobile devices to off or silent. This meeting will be broadcast live to the internet and will be capable of subsequent repeated viewing by entering the Warspite room during this meeting. Councillors are consenting to being filmed to the use of those recordings, and I'm going to apologise at this point because I've got the wrong glasses on. So it's not that I can't read, honestly. So, are we moving to item 1? No, it's too hot. Okay. Moving to item 1, apologies. Jake, do we have any apologies for today?
Thanks, Chair. Apologies received from Councillor Dr. Cree. Councillor Rainsford is substituting, and Councillor Loveridge has also provided apologies. Councillor Tofan is substituting.
Okay, thank you. Moving to item 2, declarations of interest. Do members have any declarations of interest in respect of the items on today's agenda? No. Item 3, minutes of the last meeting that took place on the 16th and the 18th of July. Do the committee agree to the minutes from the last meeting? There we go. Item 4 is Chair's urgent business. I know that all councillors had a briefing about the rack in schools, but I've asked for urgent business today just for a little bit of an update on that, if that's possible.
Right, I can give a bit of an update and then I can pass over to David and Annie. This is the update that I gave to Cabinet, and to say that we've been very proactive in communicating with our school leaders on this matter, as we knew, and rightly so, that parents and carers would have been very concerned about the news reports around the use of reinforced autoclaved aerated concrete in school buildings. Since 2018, we have carried out surveys on the 14 of our local authority maintained schools, and none have been found to contain rack. Academies and multi-academy trusts are responsible for their own school buildings, and school leaders would have been contacted by the Department for Education about this issue earlier in the year. Neither we nor any MATs have been notified that any school in Plymouth are affected by the issue, but our education team has still contacted chief executives of academies and head teachers to confirm that relevant checks have taken place and offer support if needed. MATs have welcomed this communication and support from the local authority, and to date the public statement remains accurate that rack has not been identified in any of our local schools. And if you just like to add a little bit of additional information from me, is that my comment is that sadly this might not have been the position if building schools for the future had been maintained. The cut in the school building programme directly affected Plymouth in 2010 because we were actually promised £70 million in order to work and build our maintained schools, but that was taken away when Michael Gove became the minister. And just as a little aside, and these are about political choices, but the choice was made to build free schools, and just as a little aside, as I would say, is that in Northampton, a Royal Mail sorting office building was used in order to build a free school. The International Academy, Northampton International Academy, the refurbishment actually cost £40 million, and it was actually named last week as one of the 147 schools which actually had rack, which is perhaps pause for thought.
Thank you, Sally. Any questions, anybody? No? Charlotte?
Thank you, Councillor Creswell, for that update. Obviously, the list of schools that have been contacted with just the sort of the small list of number, and the Department for Education that they notified and wrote to. There are indications that there's been a longer list. Former Department for Education secretaries, permanent secretaries have indicated there were previously longer lists. Do you have concerns that, you know, by it being a narrower list, that there might be wider issues in the city that need investigating? Are you in touch with the Department of Education on some of those longer standing issues that might not have met the high priority list but might be warranting consideration?
I'm going to pass that one over in a moment, but haven't been actually in touch. I think it's fair to say that there are the possibilities, and we've only been looking at schools at the moment, but there's probably the wider consideration. We know that court buildings have been affected, so there's the wider considerations of wider buildings that could well be affected anyway. So it's obviously very serious. And I think it's also worthwhile bearing in mind that if you don't actually keep up the fabric of your building, something like RAC is very prone to the impact of water and water ingress. And so therefore the maintenance of buildings, be they school buildings or otherwise, is incredibly important, but that requires finance and regular upkeep of those buildings. And if you consider the strains that have been put on schools in terms of financing schools, then obviously there are more potential problems, let us say. But so far, I know of nothing. But I'll pass that one over.
Thank you. I have been in touch with the Department for Education about this, and they have no Plymouth schools on any additional list. I think the concern for the department and a range of stakeholders was that there was the definite list and then there was a number of unknowns. I think that number of unknowns has diminished. There were no unknowns from Plymouth. We had done all the returns. So I don't expect that we would hear more. There is always the question about how thorough surveys are that have been done, and there are a number of different levels of intensity, but we don't expect at this moment to hear any more about RAC in Plymouth, which is good. But I would echo what Councillor Cresswell has said about the importance of maintaining school buildings. Both our local authority maintained schools and the academies in Plymouth. I think it's also important to say that the communications from the council were important in reassuring local parents. The parents did turn to the council for information, and we were able to put out that statement in a timely way.
Sally?
Could I just add one more thing, is to extend actually my thanks to Annie, to David, to Tracy Lee, and who immediately reacted very effectively and through our comms team to actually reassure heads of our multi-academy trusts and our own schools as well. And I think that's really important. And I think the heads and the chief executives of multi-academy trusts really appreciated the support that the local authority extended straight away. And I say it was also important for reassuring parents and carers. So thank you very much.
Thank you. Charlotte?
Thank you. If I have a quick supplementary, Annie, you mentioned sort of passing reference to the quality of the surveys. Can you expand a bit more what you meant on that point and the level of confidence you have in that?
Yes, so I think that some schools are out of the frame because they were built after 1990 or before 1960. So it's those schools that were built in the 60s, 70s and 80s. So we rule out a number of schools in Plymouth. So we're confident about those. I think in terms of the survey, there are the surveys that any of us in this room, and there might be some experts here, could do by looking around and see if they look like the panels. Then there is a survey by a qualified surveyor who would again look and they would make good judgments about whether RAC was present. And my understanding is that all the surveys have been at least of that level. And then if there is anything that might look possibly like it could have been RAC from schools built in that period, you might get a further survey which would involve an intrusive, probing the said panels. And some areas have done that because they thought there was a possibility, but none of those have been returned as positive.
Okay. John?
Yeah, thank you. Is there a risk of RAC being discovered in the future, but not now? So would it be wise for it to be part of an asbestos survey style rota for all schools?
I think if I describe the 3 levels of surveying, where that 3rd level hasn't happened, I think it would be wise to have surveys done to look at that. I think if they know there's no rack, it won't suddenly appear. So if it wasn't used in the building in the first instance, you won't need to go back in 10 years' time to check it's not there. But I think it is worth us promoting that most intensive level survey for any schools that where there's any slight possibility of it existing.
Okay, John. Alison, did you?
Yes, a couple of points or questions really. Is there any requirement at all on schools to keep details about improvements or works that have happened on the school? This is not necessarily specific to RAC, but do they keep records for building works? Are they expected to keep them?
Yes, all responsible bodies. So, for instance, the local authority is the responsible body for the maintained schools, are expected to ensure that the schools in their remit keep records. Sometimes in changing of hands, things do get lost, and sometimes records aren't maintained. So I'm not sure that the standards across all schools in the country are the same, but they are expected to keep records, yes.
And the second point was actually about other areas where children play and learn. We have a lot of buildings, particularly in the north of the city, that probably fall within the build period, community centres and so on. What is happening? Do you know whether there's any work happening with those sites?
I don't know. We did inquire about a couple of buildings that children also use, for instance, Downham House, and had reassurances about those. But I think we might have to do a written response to that, talking to our other colleagues across the council.
Thank you. Any other questions? Thank you very much, Annie. Moving on to item 5, the work programme. Do members wish to add anything to the work programme? No? Okay. Item number 6, tracking decisions. Members are asked to note the progress of the tracking log. Are there any queries? We have a small issue and would like to adjourn for 5 minutes if that's okay with everybody. Sorry, thank you. Councillor Harrison.
Yeah, we just before we came off air, we were just saying about the tracking decisions. Just to note that we still haven't received a response regarding the stepping up from a child in need plan up to child protection. It's still in red, so
David.
And stepping back down again from child in need down to universal.
Yeah, hi there. I can give an update if you'd like. So at the minute, when I think you asked for the information, we had just moved from one system to another. A lot of work was going on to make sure that we had our reporting in place. There is quite a large amount of requests for different bits of information which needs resource to build, and that resource at the minute is very low. And prioritization needs to be carried out to make sure that we deliver what reporting is required first. So things like statutory reporting, the DFE, things like Annex A for Ofsted, which is a case level information. So we're having to manage the resource that's available very closely, and that's why that piece of work is not being developed yet, but it is on a list of future development with about 35 other requirements.
Thank you, Paul. Natalie.
So do we have a rough timeline? You know, are we able to look at, for example, the next meeting? You know, as will be action, and we'll get that information.
Shall I take that? Good afternoon.
Yes, please, David. Thank you.
Haley, I'm the interim Service Director for Children's Services and DCS. So there are a number of items with regards to the Eclipse system, particularly the reporting items that Paul has just mentioned, that have been collected together and we know what we need to do to improve it. So we are going to go into a second phase of Eclipse where we address all of those things that need to be addressed and updated, following us having worked with the system for several months, and we aim to start that phase 2 during October. So, and I've been working with colleagues in adults on that because adults have also implemented Eclipse. So some of the resource for implementation moved towards adults for that implementation, and now we're going to share a bit of that resource so some of that can come back into children's to deal with some of the priority issues that we know we need to do. It doesn't mean to say that the system isn't working. It is working for social workers, and we can draw out of it the majority of the data that we need. But there are some things like this piece of data that you've identified that currently can't be drawn out, but will be once we've done the work.
So, okay, Natalie. Thank you. Any more questions? Okay, moving on to item 7. I will put forward a change to the order of business to bring forward item 10, domestic abuse and children as survivors, to item 7. Item 7, local areas SEND inspection, will move to item 8. And finally, item 8, unlocking Plymouth's potential, will move to item 10. So therefore, item 7, domestic abuse and children as survivors, please can I hand over to Councillor Hayden to introduce the report before going to Matt Garrett. Thank you.
Thank you, Chair, and thank you, members, for allowing me to come and speak. I promise you I'm not flying solo. We do have Matt on the screen, so thank you, Matt, for being here. So, as you're all aware, Plymouth Ofsted's report in December 22 highlighted areas of improvement around domestic abuse practice, including better triangling of domestic abuse cases, better use of domestic abuse risk assessment tools, better partnership working with our local specialists. Domestic abuse services increase escalation of a high risk of domestic abuse cases of our multi-agency risk assessment conference. Sorry, I was trying not to use any abbreviations and trying to breathe at the same time. So you say, what have we done? So what have we done since May 23? So Plymouth has made significant efforts to improve the citywide response, including the following activists. So we've coordinated a community response accreditation in July 23. Plymouth began working with Standing Together Against Domestic Abuse to be the first area in the UK to pilot the whole system approach. Tracking, and I will put this in abbreviation, but if you do need to know, let me know. It's violence against domestic abuse. So it's violence against women and girls, domestic abuse. Coordinated community response, accreditation pilot. This quality assurance programme will strengthen the Plymouth multi-agency response to ensure that everyone's experiencing violence against women and girls and domestic abuse can receive effective and consistent support across the city, that people causing harm are held accountable and given the opportunities to change their behaviour. The DASV board agreed this approach on the 19th of June 2023, and Safer Plymouth issued a final approval on the 20th of July. Part of its work will include reinstating the multi-agency assessment conference steering approach to addressing high risk of domestic abuse in the city. Another planned piece of work was part of the accreditation process in its multi-agency practice development review of Plymouth's specialised domestic abuse court, which begins in August 23. There was the launch of the Plymouth VOG strategy in 2023 to 2035 action plan to support by PCC's officers, and the DASV board recently refreshed this version. There was a city-wide training programme for the VOG, and we've also got the white ribbon accreditation. The council will refresh the domestic abuse policy. Online harm campaign, the NSPCC is leading a local campaign. I won't go into too much because obviously you've got your cabinet member for children here. We have our 16 days of activism, which will start obviously in November, so that's doing. And we held our very first Man Culture Conference, and that was it last week. And once again, can I thank absolutely everybody, and I know Matt was very much heavily involved in it, but everybody who took part in that. It was a very, very successful day. It was a packed room at Plymouth Argyle, I have to say, and some really good noise was coming out of it. We have our whole school approach. Again, I'm not shrugging shoulders here, but I'm going to leave that for Sally. And recommissioning our domestic abuse service. So I got papers and papers, but I'm sure the last thing you want to do is sit and listen to me rabbling on and getting tongue-tied. But if you have any questions, I'm more than happy to answer. Thank you, Chair.
Thank you, Sally. Matt, do you want to say anything?
Thank you, Chair, and apologies that I'm not in the room, and apologies that Megan Field isn't with us. She should be here, and as the expert in the field, it would be good if she was, but unfortunately she can't be with us. So I'm happy to go, Chair, if you want me to go through the presentation, I'm happy to go through the presentation. It's in your pack, you've had it, but I can give a little bit more context if you would like.
Is everyone happy to ask questions, and or would you like the report gone through by Matt? Could you give a bit of context, please, Matt?
Yeah, of course, that's not a problem. So if you move to the next slide, please. So this slide is fairly simple. It outlines the issues that Ofsted came up with around domestic abuse in our children's services team. There is some wider context, so that's the stuff that comes from national reviews into things like the murder of Arthur Lavinia Hughes, all of the stuff we get from our multi-agency safeguarding panels, and all of that feedback shows us that, you know, nationally social work practice is struggling around domestic abuse, and so we need to know that we need to do more really to improve the situation for both survivors and victims, but also for children. Next slide, please. So Councillor Hayden has already outlined some of the improvements, but I can give you a little bit more context about what some of those mean. So the re-procurement is about improving the offer to children as part of the domestic abuse contract. So we're in the process of re-procuring, and the new service will include much more around children as sufferers of domestic abuse, rather than just being the children of a sufferer of domestic abuse. So it helps us. There's lots more training involved. There's kind of cementing the work around trauma informed, and just ensuring that the new service is more even more fit for purpose than before. In terms of workforce, we are constantly looking at training, so things like the risk assessment training, so the making sure that people can properly risk assess domestic abuse. So that training is ongoing, and then there's some additional training delivered by my technical lead in my service, Verity, around just around DA and what it means. There's also some internal training for social workers, and that kind of just helps to ensure that our social workers are fully trained. There's also the changes around the specialist services. So Bernardo's have done a lot of work around their pathway. That's got a number of courses within it as well. Stronger Us, a recovery toolkit, and You, Me and Mum, which just help victims and survivors to make more sense of the relationships that they're in. There's also on the list White Ribbon, so that's around a DA policy for the council. And so us being clear the impact on both our staff and our communities, and having a proper written policy to deliver that. Next slide, please. Sorry, I can't see the screen. Okay, so this is some of the recommendations that have been outlined. So as I've talked about, workforce development, increasing social worker confidence, strengthening the whole family approach, putting in shadowing opportunities to help, and monthly surgeries with our domestic abuse provider, PDAS, Plymouth Domestic Abuse Service, co-locating IDVAs in early help, so working alongside in that multi-agency capacity will help improve the quality of social work practice. Obviously, information sharing and communication is always an issue across all services, and this hopes to deal with that by putting some improvements in around staff working together, and then implementation of the whole schools approach. And then the last point is about coordinated community response. So the whole of the DA system wants to work on a community coordinated response, which is just a multi-agency way of working, and will help to improve practice across the system. Next slide, please. And then, yes, finally, the Safe and Together model. The aims and outcomes in reduction of removals and keeping children at home. So it's about working in a kind of holistic way to protect children from domestic abuse, but to try and keep them in the home. We all know that removals are very costly, and this is where the business case for Safe and Together comes from. And then there's also some work around the city is also doing some work around perpetrators and trying to increase the amount of support to supporting people who harm to prevent them harming in the future. And that was it. And hopefully there'll be some questions that we can answer for you.
Thank you, Matt. I do have something myself, if that's okay. A child under 18 who is affected by domestic abuse is now treated as a victim or a survivor, and this means that they will automatically get access to support such as mental health and safeguarding. So this also means that they will be considered in the justice system, and I do know that Megan is trying to do some work on this. But I just wondered, if we're multi-agency, how much work is going on with partners regarding children as survivors, because most of the people I speak to sometimes don't really understand that that's a thing, or that they were never survivors in the first place. So I just wondered how much work is being done in that area. Thank you.
I presume Councillor Hayden would like me to answer.
More than happy.
Okay. So, Councillor Riley, you're right. I think it's plain for us that the work in the city wasn't doing what you suggest, and the new procurement of the new contract and the conversations happening at our domestic abuse, sexual violence subgroup from Safer is all about exactly that. Is about increasing the amount of support to children, how children are viewed as part of being victims of domestic abuse, and looking at specialist therapeutic support and all of those things to try and improve the offer to young people in the city.
Thank you. And I know that we do have Emma in the room with us today, who I always ask the procurement, the domestic abuse service. It's been pushed back. It's going to happen at a different time, isn't it? And I know that Emma could answer that. If you can, please, Emma.
Absolutely. So we have held an event with the providers in the city who are likely to be bidding for that contract. That took place in August, and we are just doing the final checks on the tender paperwork, so should be out by the end of September, I promise you.
Thank you very much. Matt, I am going to put a little recommendation here that Megan does update the councillors that are here today that attended this meeting, because she is the expert, like you say, in this field. Thank you. Any questions?
Yeah, that's fine.
Alison?
Thank you, Councillor Riley. One of the criticisms of Plymouth was that DA referrals were not triaged well. Can I ask what progress has been made and what changes have been made in order to make that a better process?
Matt?
I don't know whether David can answer better than me. I know that there is some work ongoing around triage within the social care team to improve it, and I know that Megan and Verity from my service are working closely with them. I couldn't tell you about specifics, unfortunately, without Megan here to tell us exactly what's happening.
Thank you. Sally, could you?
No, I was going to ask the children's director if David would be kindly come in and answer that. That was all. So it comes more. So I seem as if I'm sitting here with shrugged shoulders, but I sit from a community safety point of view, and you're literally talking about young people. So you need to have the expert there in the room.
First point I would make is that it's really strong, the joiner. So it's really moving this forward in the right direction with the join up with Megan, with Matt, with other colleagues, it being a community safety area of work, an area of work that commissioning is going into, and also therefore the impact that impacts positively in relation to children's services and the work within the MASH. And the first 2 or 3 slides identified the improvements that are taking place in the MASH. The 2 things that have really helped in relation to improving the triage are some of the staff within the MASH have undertaken the full IDVA training. So they have trained in the tools and they're embedded within the MASH, within the service, and therefore can work with the other staff and can model an approach to the triage around domestic abuse. The second is that we now do have a professional IDVA in the MASH for a part of the week. And again, that is also helping and providing capacity, and that wasn't there at the time of the inspection. So that capacity has helped, the additional capacity has helped, and the ongoing work in relation to improving the quality of triage from partners within the MASH certainly is contributing to that.
Thank you, David. Councillor Stephens?
Thank you, Councillor Riley. Can I ask, I don't know if this is Emma or Matt, but I've got 2 questions. One, how is this going to be flagged up within school record keeping and so on, that a child, a young person has been subject to an environment where there's been domestic abuse, just to ensure that children don't fall through the net. My second question is, have the armed forces welfare services been involved in this work? Because 5% of our children and young people are from armed forces families, and from experience, there's often a need for the naval welfare services, for example, or army, to become part of the work to progress to a positive outcome.
David?
So in terms of, schools, there is a process whereby schools are informed through the work that comes into the MASH. So when information comes into the MASH, there is an outgoing route to schools so that they are informed, and therefore they are aware, and they therefore, you know, support the young person with regards to the awareness that they've got. And then, of course, if the threshold is met for an assessment or for work within either early help or into our statutory social care teams, then that will progress through our service, and schools will be involved with that as a key partner. In relation to armed forces, I don't know the answer to the question. I think it's a really good and helpful question, and I'll take that back and get you a written answer.
Thank you.
Or Megan may be able to. In fact, this is Megan.
Hi, Matt. Sincere apologies. I've had an emergency morning where I was delivering a workshop and someone broke my phone. And so I've had no way of, not accident, totally, no aggression, no violence, but I haven't had a phone. Oh, sorry. So I haven't had a phone for the last 2 hours because it was broken at a workshop this morning. So I've been uncontactable.
Sorry, can I follow up on that? When I say about flagging up, about when a child transfers from school to school, would that be part of should be part of the transition of records and information about individual children?
We've had improved transition arrangements of exactly that sort of information for our children with any vulnerabilities this year, which includes using a portal to upload information securely, and that has been well regarded by primary and secondary schools, with visits in person occurring for some of the children to ensure transition is appropriate, and face-to-face information is given as well.
Really good, thank you.
Thank you. John?
Thank you, Councillor Riley. So it's brilliant to see the emphasis on children as sufferers in this, and what's being put in place to kind of help and support with that. And there's talk about the healthy relationship work in schools and the implementation of the whole school approach. But my worry, one thing I wanted to ask is, you know, of course, not all young people and children engage well in school, if at all. So I was just wondering what was being put into place to support these children and young people who might not be willing to engage in these offers that are taking place in school.
I think the majority of that work would be delivered through the social education lessons, PSHE or PSHRE. If children are in school, they will be getting those lessons. I agree that there is an issue with if a child is absent. So for those children who are absent more than we would want them to be, that is an issue, and sometimes that will be caught up with, sometimes not. I think that where their children are on the school roll, whether they're attending or not, if there's an issue around that particular child, for sure the school will be involved in the wraparound for that child.
David?
I invite Emma just to comment what she can around the commissioning process, given where it is in the stage. There may not be very much that you can say. We may need to bring it forward, but within that commissioning, I would expect there to be some support for children which is outside of the school, so that they can access if they're not in school, or school isn't the right place for them. So I don't know whether Emma can or would like to comment on that, but that would be my expectation, that those services would be provided to children outside of the school environment where it's appropriate.
Absolutely. So we are looking at a whole system approach, and I know we say that a lot, but we mean that in a very tangible sense for our children who are victims of domestic abuse. So one of the key links will be into our emerging family hubs. and making sure that everybody who works either with or around a child, including their parents, carers, neighbours, friends, have the skills and the confidence to be able to support them and wrap around them properly. So all those, this won't be a service that operates in isolation. One of the key requirements of that service when we commission it again will be how it works with partners and with the systems and the people who are around children who help to keep them safe. So it's absolutely intrinsic to that service. And as I say, I have just promised we'll get that out by the end of September.
Thank you, Emma. Natalie.
Thank you, Chair. So mine's just coming back on a couple of the questions. One is what you've just been saying about getting the papers out for September. So do you have a timeline as to when you would expect the new service to be up and running and operational?
We were aiming for next April, as with all things with procurements. We do have to flex them. It's better to allow bidders a good amount of time to get it right than rush a process and end up with a service that doesn't meet the needs of our children and families in the city. So we're aiming for April. If we have to push that back by a few months to get that process as robust as it absolutely can be, that's what we'll do.
And the second question, again, going back, we said about information and communication, both for transitional children, but I know that's harder. You've said about primary and secondary, but you've missed out early years. What's happening for early years? How are early years settings being informed if there are situations of domestic abuse? I appreciate it's harder for transitions because that communication line isn't as strong, but certainly for existing children within our system, within the early years setting system, both childminders and early years settings. Thank you.
Certainly where our services are aware and they would know if a child was at an early years setting, they will be able to contact the person who's in charge of that setting, be it a single person like a childminder or the manager of the nursery. Yeah.
Okay. I have Angela next, thank you. Sorry, Alison.
That's my fault.
Thank you. I've got a query about the way in which schools learn, in some instances, about a child who has been subject to or witnessed violence in the home. Operation Encompass, established in the city, clearly the police then have an early relationship with the school now, informing them or informing a named person that the child has had that experience. How does that feed into the wider issues here? Because I'm not sure whether the named person at the school shares that, records it. How does that translate and move on into the wider system?
Yeah, it's a good question because there's a balance between the confidentiality aspect and then all teachers, and it might be only 1 or 2 teachers in a primary school, but it might be 12 or 13 in a secondary school. What do they need to know? That perhaps that the child's had a distressing experience. So that information is usually shared on a need-to-know basis, and there is information and guidance available to schools about that. But there will be an element of making a judgment about how many people to share the information with. And of course, if the child is showing signs of distress, then more people need to be aware so they can make adjustments. They may not need to know all the detail, but they do need to know that the child needs support.
Okay. Lauren?
Thank you, Chair. I want to pick up on a point made by Councillor Hayden in relation to the 16 days of activism and whether when that programme is released and it could be circulated to members, just so we can really champion that from our end.
Happy for me to answer, Chair? Yeah. By all means, do you know what I mean? I think we all do need to champion it. So thank you for the question, but yeah, definitely.
Megan, would you like to add anything to that?
Thank you. Yes, so our 16 days programme will be kicking off on the 25th of November with a with a peaceful walk through the city, and that's the first event that we'd love to have representation at. And I know Councillors Hayden and Riley have shown a tremendous amount of support for that event, but also for the rest of the program, which will involve everything from seminars and online training, to launching our training program, to launching our coordinated community response accreditation formally, and then also events from our partners like the police and Trevi and the universities. I could go on, but that should be a more robust program than we've probably previously seen due to the coordinated communications work in the city. And if there's any questions in particular of any event, or if any of you would like to attend or be part of it, please do. My details will be circulated with it, so please do get in touch. We'd love for you to support in any way you can. Thank you. Oh, and one other thing. We're looking to develop a small violence against women and girls communication campaign on billboards and in visible places throughout the city. That work is going to be done over the next 6 to 8 weeks for, again, launch during the 16 days. If there's an opportunity for that to if there's an opportunity for display that in your ward, we're really happy to pick up that conversation with you as well. Thank you.
Thank you, Megan. David?
I asked Megan to pick up Councillor Stevens' point with regards to the support for the armed forces, retired veterans, for example. I think you've got something to say on that, because I've heard you say it before, so might just cover off that in the meeting.
So recently we started a conversation looking into, I suppose it would say, areas of additional need or marginality, and so across the city. So we've done a fair bit of work around older people, so those over the age of 55, and looking at the intersection of, I will get to armed forces in a sec, the intersection of age and dementia and caring needs, and that has led to a peninsula project around raising awareness of and supporting older people experiencing domestic abuse more effectively. That was the first area that we looked at. We're now that we kind of have that underway, we're turning our attention to other areas of need, like the experience of domestic abuse by people in the armed forces. We've had an initial conversation with a few leads around the city, and we've also looked at the data from our frontline services around if there are what sort of the numbers are for people experiencing domestic abuse from the armed forces, and what folks are doing about them. So we're beginning to build a picture of the need. At the moment, I would say that the data doesn't meet the need that we suspect is there, and so moving more towards the end of this calendar year, that's an area, sort of a deep dive area that we're going to be looking into, because we've consulted colleagues in Portsmouth, which has a similar breakdown, and also national guidance would say that this is not a problem that we can ignore here in Plymouth.
Thank you. With permission, Chair, because the armed forces, some of their family welfare support services, even if it's for 1 or 2 children, and they work for that 1 or 2 children and their families, it's worth having them on board. Absolutely. Yeah. Thank you.
Absolutely, and we've I do believe that is written into the specification as well, in terms of one of the areas of development and need, and working more closely across the city.
Okay, I'm going to take one more question on this, which is Councillor Beer, but I have asked Megan if it's okay for you to give your report in a briefing, send it out to councillors via email, if that's okay. Thank you.
Thank you, Chair. I want to pick up on a point that Councillor Harrison raised about early years and young people in settings such as nurseries, childminding, those types of settings. I wasn't confident when you answered the question that there is a smooth flow of information for those children that could be affected by domestic violence. I also reflect on the comments that we often hear, that we learn from our mistakes. Are we still learning from mistakes? So 2 questions there, and that's only because they're burning in my head. But early years setting doesn't seem to flow for me. You have not explained that and not filled me with confidence, I'm afraid.
And I'm sorry about that, and it might be that David might want to come in from a social care perspective about that communication with the setting. We do know that if there is an incident, the people involved are contacted, definitely. But I don't know if you want to say more about that process, David.
So that would be where anyone has raised a contact with the MASH, so any setting would be contacted for information and to triage information that was coming in. So that would be a childminder, nursery, etc. I think your question is also about what's the routine feeding of information into those early years settings in the same way that Operation Encompass feeds into schools. Yeah, so, and I don't know the answer to that, so I will take it away and find out. I mean, certainly there should be big opportunities through the Family Hubs programme because that's focused on 0 to 5s, but I don't know. So as you can imagine, having been in post for just 6 weeks now, I'm finding a lot out. So I'm adding to my little list here of things to go away and find out. So when I found it out, I'm very happy to send a note round so that you can be assured that the right processes are in place, or indeed, if I find that they're not in place, what we're going to do to put them in place.
That would be most helpful, because I think that my confidence is being knocked by the fact that I haven't got a clear pattern as to what would happen to those children under 5 who are in their nursery childminding settings. So that would be helpful,
I mean, I think just
not just for me, but for the rest of the
but just
panel.
to be really reassured that if there was any contact into the MASH by any professional around those children, then they would know. So we're talking about if there is other information that professionals know that isn't routing through the MASH, which would be unusual, but I think that's what so I can give you assurance that if it comes in, then those early years settings will know, because they'll be involved in information gathering, and they would certainly know that. But we'll have a look at it in the round just to make sure it's as robust as it needs to be.
I'm very grateful to you, David. Thank you.
Okay.
Thank you. And I think that's about an individual child or an individual family. We also have very regular and focused communications with all of the managers of early years services, childminds, etc. There is a network and there are briefings for them. So there is a regular flow of information and meetings with those colleagues.
Do you mind if I just ask how those briefings are given to these settings? Because I've been looking after a 2-year-old during the summer holidays, and it's been bedlam, quite frankly. So I can imagine that if you were a childminder with several children to care for, you didn't have time necessarily to sit down and go through briefing papers. So how is that communicated?
Sorry, Councillor Beard, I'm going to have to ask for that to be brought to you in an email or something, because we really do need to move on. I'm really sorry. Thank you, Matt. Thank you, Megan. And thank you, Councillor Hayden. Moving on to item 8, local area SEND inspection, report and briefing. Please can I hand over to Councillor Creswell to introduce this item before handing over to Annie Gammon, Services Director for Education, Participation and Skills.
Right. I will just give thank you, Chair, I'll just give a very brief update on where we are. The Area SEND Special Educational Needs Inspection of Plymouth Local Area Partnership took place from the 26th to the 30th of June 2023. The inspection report was published on the 22nd of August 2023. The report does not make comfortable reading, and we fully accept the findings of Ofsted. 5 areas of priority, 9 strands of action were identified. One area in particular relating to vulnerable children living in residential special schools and children's homes at a distance and children receiving short breaks was addressed immediately so as to ensure assurance of their safety. Cross-partnership work has been going on to communicate about the report and get engagement to develop and implement the action plan for improvement. Officers have liaised closely with health, with school leaders, with Plymouth Parent Carer Voice, that's PPCV, which is the Plymouth Parents Carers Forum, which brings together parents, carers of children with SEND and the young people themselves and the DFE. There is a senior officers portfolio holder and DFE meeting which took place yesterday, Monday the 11th of September, that I attended along with Annie and David and other representatives from health, etc. A workshop involving stakeholders, which will include, as well as PCC, NHS and named school and college leaders. which is planned for the 20th of September. The first SEND Improvement Board will be on Thursday, the 21st of September, and then it will be 6 weekly. The action plan will be ready, in fact, on the 29th of September, but it will be published on the 3rd of October. Fully accept the report from Ofsted, but I think it is important to actually note again as well, is that of interest again, in February 2020, Ofsted's own research revealed that children with SEND or disabilities were particularly affected by the ongoing financial pressures being placed on schools. And in their survey that they did in 2020, an Ofsted questionnaire, and of the primary heads that replied, 80% of them, and secondary heads who replied, 72% of them, said that changes to SEND provision had been made due to financial pressures. And we do need to keep this actually and bear this in mind. There are greater and greater pressures for, and we are, for our most vulnerable children, for our SEND children, at the same time that there are increasing demands as far as finance and such is concerned. This is not easy for those people who work every day within and look after and are very committed to looking after some of our most vulnerable children. Thank you.
Thank you, Councillor Cresswell. And councillors, you have both a summary and the report itself in the pack and a timeline. As Councillor Cresswell has indicated, we don't want to be in this position. We regret that our services have not been strong enough to be in a better position, and that's a regret for the children and families, the children with special educational needs and disabilities and their families in Plymouth. But we are determined to tackle the issues and make sure that we improve the situation collectively as a partnership, because it is an inspection of the partnership and it needs to have a partnership response. And we want to make sure as we move forward that we are building in real ambition and aspiration as in a bright future for our children with SEND. We also, in tackling the 9 areas, which I will say a bit more about in a moment, we want to make sure that we prioritise and are realistic about delivering, so that what we set out to do, we do deliver, and that it has appropriate impact for the children and families. I think Councillor Cresswell has touched on the logistics of the report coming out, and the work on the action plan is ongoing. I'll say a bit more about that, and that plan will be published in early October and set out what we need to do. We will then be inspected again in 18 months, but there will be touch point meetings with the DFE every 6 months. And as we look at accountability, we expect that we will have be reporting more often than that to a board. If I touch on the priorities that come out, and just say there were some areas that were noted as effective, and those are in 3.1. Things about commitment, about some strong work in schools, some work with the youngest children, some work around social and emotional needs, and some work for our post-16 children. However, the areas for priority action are going to be important for all our children and for us, and for this panel to review our actions to see that they are having impact. Some of those actions are joint, and you can see in 3.2 or in the report itself the responsible bodies listed. So for those first 2 actions, it is ourselves as children's services, so both the education side and social care side, as well as our other colleagues who support us, NHS Devon Integrated Care Board, and school and college leaders. And those priority actions are about making sure that children with SEND are at the centre of improvement plans, and that the plans have clear oversight and tracking in order to measure impact. And that together in the second action area, that we are better at identifying early children who are at risk, children with SEND who are at risk of increased vulnerability. And we know that some of our most vulnerable children are known to all those services. They're in a school or possibly not attending school very well. They may have an EHCP. They may be known to social care. They may have a health issue. So there's a combination of issues and needs for the child and a combination of services working around them. The third action is for the City Council and school and college leaders about reducing the likelihood of exclusion for children with an EHCP. There is an issue for the Healthcare Board about waiting lists, and for Plymouth Council about the children and young people with SEND who have social care needs, who are living outside the local authority. And I should say that we checked that those children were all right almost as soon as the inspection had finished. So we can assure you that checks have been carried out for those children and will continue to be carried out on a regular basis and to be overseen well. And then the areas for improvement are around consistency of approach across for all children with SEND, around the Healthy Child programme and the graduated response, about waiting times again, about training for all professionals involved with children with SEND, and about us planning ahead to make sure if we know there are changes happening in cohorts coming through as they go through our systems, that we have the right plans in place to meet their needs and the numbers of children coming through. We have taken some actions so far, and those are set out. I would say that we have a draft plan that we spoke about with the DFE yesterday, but we very much want to make sure we have engaged across as many stakeholders as possible. So the workshop on the 20th is important for engaging with school leaders and other colleagues from across levels of working with children, from those very much at the front line to those who commission services, to those in senior positions, to make sure that we are getting everybody's perspective and really get the plan right as we move forward. And I think it's important that once that plan is published, that we make sure that everybody knows about it, everybody who works with children with SEND. Councillor Cresswell mentioned the involvement of the Parent Carer Forum, and they've been very actively involved in helping us with the plan and about what the outcomes might look like for children with SEND. What would really have changed for those children if we get this right? We have sent out communications about this, and we will continue to do so to all stakeholders. So we have made a public statement about it. And I think it's important as we move forward that we report back to this group, and I know that's on the work plan, but we will expect to be making sure that we are transparent about progress and any issues that we encounter.
Okay, David, do you want to add anything? No? Okay, so I have Councillor Carlisle first, thank you.
Thank you, Chair. I appreciate what we've been doing with SEND children, especially with placements and how restricted we've got. But I think for me, one of the biggest lines that sort of stood out on this report was the very first one, where it says children and young people with SEND are not placed at the centre of the essential services in health, education and social care. That almost feels to me like a cultural change that we need to have. That's not almost just by financial. It feels that why aren't they putting them at the centre? Why did Ofsted turn up and not feel that our team had to put SEND children at the centre? So it's really, I think for me, I'd be looking for reassurances that that type of thing has changed as well as everything else that you're being implementing.
Annie?
I agree that the children with SEND should be at the centre of every services plans. They're not the only children that we serve, but they're vulnerable, they're part of our responsibility. We need to make sure that we look after them well, and that's we in education, participation and skills, we in children's social care, we in schools and colleges, and I think it's important that, and we've been engaging with chairs of the head teacher groups, that our schools and colleges are also putting children with SEND at the centre of their improvement plans. It's a joint effort.
Okay.
Thank you so much, Annie. But what are we doing to make sure that the sort of the cultural change happens with the staff so that they do start making sure that that's being implemented? How are we putting that forward for the staff so that that's something that's high priority for them to do?
There is an element of culture change that doesn't happen instantly. So part of it is about professional development and the discussions that we have with our staff. So for instance, at the forthcoming service sessions, which David is leading, we are going to be looking at 4 case studies of children with SEND, and this is for all children's services staff. And they are some of the case studies that were used in the Ofsted inspection, where there are children known to all services. So there is beginning discussions and to some extent professional development. Not all social workers will have in-depth knowledge of special educational needs or disabilities. So that's a really important part of the range of professional development for all our social work colleagues.
To that, in terms of, I think we have to recognise the work that we do need to be part of with all of our partners in relation to cultural change, and cultural change takes time. So we can do a series of quick wins in terms of processes. We can address some of the issues that were raised in the report and the feedback around communication, around meeting with parents. We can do a set of things which are going to bring about improvements for children and young people. And alongside that, we do have to work through the cultural change piece, and we do have to do that collaboratively with all of our education providers, 0 to 25, as well as all of our health providers, as well as our voluntary and community sector. So I think we have to recognise and not underestimate the piece of work that there is to do across the whole city in terms of that dimension, in order that we can have sustainable change for children and families moving forward. So, inspection in 18 months' time, what I would expect is that Ofsted and CQC would say that the City Council, along with its partners, has taken the right action and is moving forward in the right direction, and they can see evidence of that. But I don't expect that to be fully formed in 18 months. It will be a work in progress. But what we have to have is the set of things that can be done and fixed quickly done, ticked off, and recognise that we've done those. So it will be a multifaceted action plan that addresses all of those things going forward. But I will say, I'm very impressed in relation to the partnership response that there has been. There was a meeting yesterday with our partners, and really everybody is responding very, very well, and understands the importance of getting this agenda right for children, young people and families across the city. So, that's a first step in bringing about the change that we need to bring.
Thank you very much. Councillor Tippett.
Thank you very much, Councillor Riley, and I'm not quite sure where to direct my question, and I will say, if the Cabinet members are answering, I take my question with a pinch of salt, because I know you were only in post for a month when this Ofsted inspection happened after taking over from Councillor Carlisle, so I know that you hadn't had your chance to fully get your hands on the situation by the time the inspection took place. And so my question is around speech and language therapy. It really concerns me to see that there is a lack of mention of speech and language therapy within the report, as it's known across the sector that it can be one of the most influential things to help children. At the moment, it's reported that 1.9 million children across the country actually experience speech and language challenges that then can lead to them being over 6 times more likely to fail their English and Maths GCSEs. So what's being done in Plymouth to make sure that our children that need speech and language therapy are accessing that in a timely and prompt manner, because we know how a small intervention from SLT in early years and in primary education can really make a difference to their future. Thank you.
Councillor Creswell.
Just, I will hand that over to be answered in more detail, but just we one of the focuses we had, because we were looking at the issues of send and improvement and such before we actually had the inspection. And certainly one of the most important areas to be looking at, and which we have been addressing, is that of early intervention. I'm sure that Annie will be able to add more on that anyway, because that is actually key, because we're talking here about about EHCPs, but it's also the whole progression by which children are identified with special needs don't necessarily end up always escalating up to having an education and healthcare plan. And ideally, if there's early intervention, the resources for early intervention, that is likely to hopefully result in better outcomes for the child. So I'll pass that one over to Annie to give a more specific answer.
And actually, we're fortunate because Claire Hetherington, our principal educational psychologist, is here for the next item, who will give a more detailed answer than I would. So, Claire, do you want to speak?
So the question was about speech and language therapy and the importance of early intervention for children who might be developing or showing signs of early language and communication difficulties. So we have seen a rise in children in the early years, in particular, following COVID, approaching school age with very limited language. And it's been an area of focus through a new development called the Stronger Practice Hub, which we've developed in conjunction with one of our executive head teachers to develop a centre of excellence for training to reach out across all early years settings. This is something which has just started this last academic year. And so we have a rolling programme of training. We have a dedicated special educational needs coordinator, and we're building on the expertise which was there, but was in a limited sense in terms of volume, from work with an advisory teacher with specialist qualifications in speech, language and communication in the early years, working in conjunction with a dedicated speech and language therapist. Now, coupled with that, we have also recently acquired the licence from the Autism Education Trust in early years to deliver training, their evidence-based, very good resourced training across early years settings. And as you may know, quite a large part of the needs of children who have that neurodiverse profile is a difficulty with speech and language. And at that early stage, it can be difficult to tease out why a speech and language need is occurring. So it's quite a complicated range of factors that are feeding into the early years. So there is a lot of work going on there, which needs to be probably pulled together and coordinated as part of the SEND inspection planning. With regard to school-age children, the Speech and Language Therapy Service have introduced an early help mechanism whereby you didn't have to make a specific referral and wait for that referral to be taken up to have access to a speech and language therapist. So they could provide a consultation, and that work has been done certainly more in the last year than previously, and I believe that SENCOs have reported favourably on that. And the Speech and Language Therapist Service is working closely with the communication and interaction team from within education to bridge that gap between the medical need and analysis and the educational provision. Is that sufficient for so far?
Yeah, that's really helpful. Thank you so much for the answer.
Thank you. Councillor Beer.
Thank you, Chair. I just didn't know where to start with this report because it was quite shocking to see the findings in it. But my question is around education for young people with SEND. Can you tell me why it is that some of our SEND children are doing part-time education hours in mainstream schools, and why we haven't got a wraparound service for those young people? I have been contacted by many families who have told me that this is the case for their children.
Thank you, Councillor Beer. Part-time timetables are allowed in the guidance and legislation for a temporary period if it is helpful for the child to, for instance, to recover from a traumatic incident or for certain approaches to be put in place, and I think we might hear a little bit about that in the next item. They are not a long-term solution. All children should be in full-time education, and these should be used in very rare incidences. They are too prevalent in Plymouth and I think used too readily by schools, and that is something that must be addressed through the plan and was beginning to be addressed. So the beginnings of that work are there. Schools will sometimes say, and from their perspective, it's really difficult to manage this child. We're struggling, we need another teaching assistant, or we need something else. But I think there is something there about making sure every child is in full-time education. That's the expectation, and the staff in schools, sometimes with their own additional help put in, sometimes with additional support from outside, are skilled enough to work with those children.
Chair, I've got a supplementary, please. I take on board what you're saying about the provision, but have we got enough provision for SEND children? Because you've talked about, we've mentioned this about going into mainstream school and not being able to have the wraparound care for that young person to be able to do the learning. Have we got enough provision, school provision, for our SEND children to go to a special needs school, for example?
So the majority of children with EHCPs are in mainstream, and that is right. I think that should be the first option. We know for some children throughout their educational life, because of their needs, and for some because a need might become more severe later, that they do need to be in specialist provision. And up until a short number of years ago, there was sufficient mainstream state provision in Plymouth. That isn't the case as the numbers of children with EHCPs have gone up. So there is a shortage, and there is a sufficiency plan underway. So we will need more places. But that needs to go alongside our mainstream schools being as inclusive as possible. So it needs to be both approaches being used.
Okay.
Yeah. The provision, I know we've got a shortage of spaces for our SEND children, and I hear that loud and clear. What are you actually doing to increase that level of SEND places for those young people? Are we looking at opening another provision?
We are looking at options which include opening another provision or expanding existing provision and increasing the number of specialist units in mainstream schools. And we think the final answer, which we need to make a decision about fairly quickly because we need that provision on tap as soon as possible for our children, would probably be a mixture of those. But it's obviously building new schools is a significant investment, and does take time. So it's really important that we make those decisions, and we have a timeline around that. So we expect during the coming months to be able to say more about what we're going to do.
Is that okay, Terry? Councillor Stevens.
Thank you, Chair. I think we need to hold on to the fact that in the report it does say at the start that there's faith in the council and the officers for the vision and the plan that's presented. That the challenge is how to get those partnerships working, and the key partnerships are the schools, and I was interested in what you were saying about culture as well, and because some children are thinking of exclusion. It's an absolute last resort for some head teachers to exclude a child. But I do fear that in some settings, it's part of the culture that action comes sooner than is necessary. So at the start of a school year, most schools will have definitely set their development plans for the year, an improvement plan. How can you ensure that all city children's school, the children in the city who have SEN, whether they're in a maintained school, a special school or a MAT, because they're still city children, no matter what blazer they have on or emblem on their shirt, how can you ensure that all those schools are contributing to the improvement of SEND and children's social care in the city? Because if they don't buy into it, it'll work. Let's go back to our earlier conversation about maintenance of school buildings. Because if we don't maintain our school buildings, we get kind of long-term damage. That's what will happen to children, primary and secondary, and all children in between and before and after. That's what will happen to children with additional needs, whose need can actually be managed, and they can flourish in ways that wouldn't have thought possible because of that, or children who need enhanced support. If that support isn't put in at timely times, they will be damaged. And as people, that has a long-term effect on them, their families and society. So how can we ensure that all schools are held to account for contributing in partnership to get this good outcomes, positive outcomes in the next inspection?
Thank you. It is much easier to get buy-in from willing partners, so I think part of the answer to that is the discussions and coalescing around a common goal about that bright future, safe, happy and healthy, aspire and achieve for all our SEND children across the city. I think there is something about making sure we do have a common, well-articulated goal that we're all working towards. I think schools will always differ somewhat, and they'll sit on a spectrum of inclusiveness. I would probably agree with you that we think a number of our schools should be further along the inclusive route. We would want to offer support, and we have, for instance, during this term, an audit with the secondary schools going on from two of our external partners and internal partners from our SEND and School Improvements team. And that is to make sure they are as aware as possible of what can be done, what support is in place, what training can be put in place. There is also the sort of accountability, I don't want to say stick, but that pressure on schools as well. And we did have reassurance from our DFE colleagues yesterday in the meeting we had with them that if we found that there were schools not doing enough, that they would be involved in those discussions. We also know that any individual schools where there's an Ofsted inspection, Ofsted inspectors will be aware of the report. So I think we would hope that there is a willingness to coalesce around a goal which is our moral duty and should be the aspiration for every head teacher to make sure their school is inclusive as possible. But we do have some accountability systems in place as well.
Thank you. And you've got a meeting coming up with head teachers, I gather. Have you had a meeting with head teacher, school leader representatives?
So we had a briefing with head teachers last week, and next week we have an in-person meeting with school representatives, and we will continue to have discussions with head teacher groups and head teacher representatives. Yeah.
Can I ask another one as well? Sorry. I don't know if I'm allowed to ask, but I would really be delighted if you were to go down the route of more support provision in mainstream schools. From my experience, it works. It's a win-win for the children who don't have special needs, and it's a win for the children who have, because the blend of expertise that you can have in that school setting benefits all children in the school and professional development of staff. So that's I hope that's a route that can be explored quite seriously. And the other thing is, obviously, they only assess a sample of schools in Ofsted, but Are there strengths in maintained maths, special school provisions, alternative provisions? Is it possible to extrapolate where the most challenging issues are situated, or is it across the board in terms of the implementation of what we would hope children should have?
I think there's a spectrum. I mean, I think they did look at. I think they only visited 3 or 4 schools, but they looked at children's journeys through a much wider number, and they had feedback from over 400 parents. So I think there was a wide spectrum there, and I think there is good practice in all sectors. I think I would say, and I think the schools would say and have acknowledged it because they've had an inclusion focus at secondary level. All through last term, that secondary phase is more significant in terms of some of the issues around exclusion and early help.
And can I ask my final question? Sorry, and is it possible to use the good practice in the city, good practitioners, whether they're teaching assistants, teachers, Senkos, etc., to work alongside those who are deemed suitable for nurturing a bit more and training up?
I think it's essential, I think it's essential to make sure the good practice in the city is shared, and there is that sort of coaching, mentoring role going on. But as well, we would hope to get some speakers from outside the city as well, of schools that are inclusive and high achieving, to come and talk. So I think that's always helpful also.
Councillor Creswell.
If I could just to add to that, because Annie and I have been talking about that very thing, and we know that sharing good practice is really important, and there are some examples of very good practice in the city, and the secondary schools have these tensions in that although an Ofsted inspection of SEND has got one message with it, the secondary schools also are subjected to, as primary schools are, but Ofsted inspection, which might be looking at quite strong aspects of behaviour and also a zero tolerance and all of those kinds of things. So there is a tension that exists between inclusion on one hand and behaviour on the other hand, and so there is a real tension that heads actually face. Now, some heads actually overcome those remarkably well and are very, very inclusive. And what we need to do is we need to be celebrating that in some way and making sure that we actually roll that practice out, that we have perhaps others from other authorities who have got very good examples which they can come and they can speak to and share that with staff, because when we go back to what Councillor Carlisle has said about that change of culture and such, that has to be done. You have to take people with you. That is a longer journey. It's the journey that we have to make. We have to do the quick fixes and the things that we can do, but long term, as you would know, John, in your professional position, how you actually move everyone along that line towards greater inclusion. And I would agree with you, there is a massive advantage in having units and also in including children within mainstream school. And one of the areas that we might also be looking at, which is relevant to one of the things that Councillor Beer has raised, is about how we actually perhaps, especially as I think there's likely to be more places within primary schools, or our primary school numbers falling, then there is opportunity then for perhaps actually having specialist units within some of our primary schools. Thank you, Chair.
Thank you, Sally. I have Councillor Macleay.
Thank you, Chair. And I wanted to thank Annie, David, their teams and the Cabinet members for their response to this. And welcome to the role, David. It's been a very interesting time to take it up. I did want to pick up on one area which relates to senior leadership and how changes in that have been to the detriment of the provision. And I wondered if we could get a little bit of an update on the hiring timelines and what assurances you can give to members that the transition will be smooth and to the benefit of this plan.
Shall I take that in relation to, so I think it is recognised that there are a number of areas across the directorate where there are either people that are in interim roles or where there are some vacancies currently. So one of the priorities of the council is to work with children's services. So I'm being really well supported directly by colleagues from HR in order to set out the priorities for the recruitment for permanent posts alongside recruiting to interim posts, so that we've got some capacity now whilst we recruit to the permanent posts. So we have a programme of that in place over time, starting with those posts that we consider to be most important to get into the structure that the other posts then relate to. I don't think that the post that Annie is filling has been out to recruitment previously, and it's being lined up to go again very, very shortly. So that will be in recruitment phase within the next week or so. So that's a key post clearly to be able to fulfil with regards to the delivery of the local area SEND inspection.
Annie, would you like to speak? No? Sorry, Councillor Lang.
I just wanted to add that, yeah, I mean, it's really important, stability in the senior leadership team in this, in anything to do related to children and young people is really, really important. But by the same token, I would have to say that David has made an incredible start, and I was a bit shocked when you said he'd only been here for 6 weeks, because it doesn't feel like that. And also, he did I thought, quite fundamental thing when he started and said, I am, yes, on paper an interim DCS, but actually statutorily he is our DCS. And I think in terms of the service and how they're feeling, I'm talking about children's social care obviously, I think that's quite an important distinction. We're not talking about interims. David has this role at the moment, and yes, the recruitment journey is happening, but I think even in 6 weeks, and like I say, it sounds weird to say that, there is a feeling of stability around that. But yeah, it's absolutely key that we get that right in terms of other inspections that we know are coming down the line sooner rather than later.
Thank you, Councillor Lang. I have Alison next, please.
Thank you, Councillor Riley. Two parts to a question. The first is probably a simple yes or no. The government have launched this Developing Better Value in SEND. 55 councils have signed up to significantly cut their SEND budgets. Can you confirm that Plymouth, in the light of this report, isn't one of them, please?
Plymouth is not one of the better value councils.
Thank you. The second part of the question, NHS Devon Integrated Care Board is integral in terms of doing the assessments. You didn't mention them when you were talking about the partners you'd been meeting. How good is that relationship at the moment, and how engaged and on the same step are they as Plymouth in terms of making sure that the report's concerns are addressed?
Will I just take that as strategic and then ask Annie? So one of the structures within the governance around the action plan will be a strategic executive group, which I will chair, and I've had the sign up from all of those people at the strategic level, from health, from not because we haven't been able to talk to schools, not that schools haven't said they'll be part of it, but we haven't had the conversation with them yet. So I expect schools to be on there, and health have been very, very, they're at the table, they want to be at the table, and a senior member, well, the chair of the board, in fact, the ICB board, will be the co-chair of this executive group. So the purpose of the executive group is to bring forward all of the strategic leaders that have got the ultimate absolute decision-making power within the system, to be able to say things will happen, we've decided this and it will go forward, and also to help be solution focused and unblock things in the system if we want to. And that new executive will meet on a 3-weekly basis and report into the SEND Partnership Board. So at strategic level, there is enormous commitment from our health colleagues at the highest level.
Thank you.
Okay, I have Natalie.
Thank you, Chair. It's, going back on something that was discussed a little bit earlier, it's really about the assessments of children. It's stated that after the inspection that some of the children in the first group were prioritised and triaged and have been assessed. There is a cohort of children that receive non-residential short breaks and non-residential short breaks that have been requested that have not yet been assessed. It says that that's going to be done by the end of October. I note that there's a little bit of slippage already on when the action plan is going to be published because it says 29th of September and we're now talking early October. Are we on course for all children to be assessed as per what the action plan says by the end of October?
Yes, we are. That is, and I'm sorry about it. The 29th of September and 3rd of October. Sort of 29th is an internal date for our plan, and the 3rd is the external. So I'm sorry about that.
Could I just say, sorry for chipping in, but just to be really clear on this, the 3rd of October is the date by which the plan has to be submitted to the Department for Education. Then they will feed back to us, and then we'll be in a position to publish the plan. So just to be clear, you know, it won't be published publicly on the 3rd. That's the date. I did speak to their senior officer yesterday asking for their return on it as quickly as possible, and I've asked for it to come back within 2 weeks. Now, that won't stop us from doing the work in the plan, but we do have to take any feedback and make any amendments accordingly following the feedback from the DFE. So it will be mid-October by the time the plan will be able to be published.
And just to add to that, when we met yesterday, we actually, you know, there is a draft plan in place. The discussions about it were almost as if it was like you know, but it's a draft plan, and that publication date is set as the 3rd. It's just that we've managed to. The teams worked really hard to actually get a lot of this planning together for the plan, so it will be well ready and will be finished by the 29th.
And then the point about the children. So those that were in residential care outside the city and those who are entitled to residential respite, the sort of short breaks, overnight stays, have all been assessed, and they were being assessed anyway, but it wasn't being held well in one place. So that is all in place and will happen regularly. There are then some children who have applied for or get short breaks that aren't residential, but they're important respite activities, and there are checks going on those, and they will be finished by the end of October.
I don't have an... Councillor Stevens?
Sorry, are all schools expected to have an inclusion development plan?
I think that's not explicit. All schools will have a development plan. We haven't asked for it. I think some of them will have inclusion in their plans.
Okay.
Yeah.
So I think that we ought to be explicit that that would be an expectation. So I would expect all schools to have a plan which sets out what their approach is to children with special educational needs and disabilities, and for that to include how they're going to be inclusive, and that will inevitably lead, I'm sure, to a plan of things that they would want to do within their school, within their curriculum, to make the school increasingly accessible for all children. So I think we should take, you know, your question as a point for ensuring that we make that explicit. Now, of course, we can't, as a local authority, insist on that, but I think that would be seen to be very good practice.
And you monitor SEN provision for maintained schools. Do you, because of the statutory responsibility for children with SEN, do you get copies of MAT inclusion reviews?
We don't. We get copies of things related to individual children with an EHCP, but we don't necessarily get MAT inclusion reviews, although MATs have generally been open about sharing with us. But again, that would be something of value to us and something that we could expect.
Thank you.
Councillor Creswell.
I was just going to say, and I don't know if this is appropriate for me in the position that I'm in, but one of the things that was raised yesterday in the meeting was one of the key aspects is accountability. Who is accountable as far as this this plan and such is concerned? And of course, that accountability lies with you people, in fact, here. And you've just raised the issue about schools and having their own inclusion plans, their own inclusion action plans. Perhaps that's something that we ought to have, and you should be actually asking heads of multi-academy trusts and others to actually come here and explain their accountability, their own inclusion that goes on with school as a means of actually informing and also sharing good practice, and also as part of the accountability itself. I don't know if I'm appropriate to say that, but
yeah, and probably appropriate to say we've got Rachel Crozier from ACE here, who is a school leader, but probably on the receiving end and probably knows quite a lot about how inclusive schools are from the children who come through to ACE, our pupil referral unit, but she'll be speaking about the next item alongside Claire. So it absolutely would be appropriate to have school leaders here.
Okay, I don't have any more questions. I would just like to use a second to thank David in his short time here so far, and all the officers for the work they're doing. But I'd also really like to thank Annie for putting together a briefing in such a short space of time. So thank you very much for that. We are moving on to item 9, Educational Perspectives on Emotional Health and Wellbeing, EHWB. Please can I hand over to Councillor Cresswell to introduce this item before going to Annie Gammon and Claire Hetherington.
Educational Perspectives on Emotional Health and Wellbeing. Right, the purpose of this report is to provide information. Children's emotional health and well-being is always crucial, and we are well aware of the very significant increase in children showing signs of emotional distress. The report sets out the support in place for children from an educational perspective. An overview is given of the educational position in key areas impacted by emotional health and well-being. This includes implications of mental health and strategic planning processes to promote the vision of a bright future within the priority area of health and happy. Understanding how emotional health and well-being relates to special educational needs in the area of social and emotional mental health is described. This is a very important link. There is a section in the report on attendance and engagement with school, and I would just add at this point, my past life I was actually a special educational needs coordinator in school, and at the moment we are also working on we have an attendance strategy and a campaign on attendance, and certainly children's happiness in school is going to be very key for them to have that high level of attendance that we're actually searching towards. Strategies for early help and support using a graduated approach are referenced, together with a summary of current education provision and planning. And one thing I would ask Annie if she could possibly elaborate on is the graduated approach, because we're quite aware of EHCPs in school, but actually how we gradually move into having an EHCP for a child, and the graduated approach that takes place prior to that. So thank you very much. Thank you, Chair. Thank you, Annie, and I'm handing over to you and also to Claire.
Yeah, and I'll just say a few words first, and Rachel. Yes, yeah.
Sorry, and Rachel.
So just to pick up on what Councillor Cresswell was saying, we know nationally that children's mental health, their emotional health and well-being is a real concern, with increasing numbers of children, particularly teenagers, but not teenagers alone, seeking support for their mental health. I think it's right that this report draws out the link between mental health and social and well-being and social emotional mental health as something that is one of the special educational needs strands and criteria, and Claire will talk a little more about that. In terms of the graduated approach, this is the approach that schools use if there is a child showing signs of not being able to participate well, an issue that might be to do with special educational needs, that they will try putting in more resource, try a different approach, assess how that's going and review it. And that would be expected to happen before a child gets put forward for an EHCP, which is the more serious end of recognising a need and ensuring the child is well provided for. So that graduated approach is something used by all schools. We'd like there to be a bit more consistency about it, but it is used by all schools and is different from the graduated response, which is sometimes talked about, which is more of an early help and cross need of children response to something that's happened to the child. Without more ado, I'm going to hand over to Claire.
Thank you. So emotional health and well-being is an umbrella term that can cover a wide range of needs, from self-esteem, confidence, feelings of well-being, right up through to children who might have diagnosed quite serious mental disorders. And the factors that feed into emotional health and well-being can also be very varied. And we'll talk a little bit about those as we go through the report. But emotional health and well-being can have a wide range of impacts. It can impact on a child's ability to thrive in terms of their development, their wider holistic development, and that includes their ability to engage with education, with both teaching and learning, and relationships with others in school or outside of school, in their families and in their wider communities, and also with their peers. There are a number of statutory frameworks that where emotional health and well-being can be seen as a factor that can be followed through. So the Children Act and the Special Educational Needs Code of Practice has social, emotional, mental health as one of the categories of special educational need. Also keeping children safe in education, that also has a bearing on children's emotional health and well-being and how others provide for that. And when we're planning for emotional health and well-being, we plan at the individual child and family level, but we also need to plan right through to a strategic level. So A Bright Future has one of the aims as being to support children's emotional health and well-being. Our SEND strategy in education, participation and skills has a focus on social, emotional, mental health. Our inclusion strategy and the developments within it needs to focus on emotional health and well-being and how that impacts on children's ability to engage, access with education, and the people around them, their ability to support those children to do that. There is also a wide network within Plymouth, the Emotional Health and Wellbeing Steering Group, which has representatives on it from education, health, care, and also many private providers across the city. So there is a huge interest in this area, but also in actually looking at how services can be joined up or how they interface with each other. So it's a very wide-ranging area. In terms of the prevalence, we have seen an increase in more serious aspects of children's mental health. So the Children's Commissioner reported that in 2017 we might have seen 1 in 9 children with a mental health disorder. moving from that into 2023, that's now 1 in 6. And we've seen the biggest increase since COVID in the adolescent group, the aged 16 to 19, who have been probably, it's quite complex with a number of factors, but probably most significantly affected. So we've got nearly 26% of children of that age range across England with mental health disorders, and within the younger age range from 11, we've got around about 20%. So those are health diagnoses rather than education. From an education perspective, we're looking more broadly than that, because we want to look at whole school approaches and system approaches to support children at an earlier stage before they develop a mental health disorder. So I mentioned earlier that we can see a range of factors that feed into a profile of emotional health and well-being needs. And that range of factors spans social, educational and health areas. So if we look at children's early life experiences, for example, adverse early life experiences and children who've had insecure attachments can lead to emotional health and well-being needs as a child and in later life. From a health perspective, there are specific mental health disorders which are diagnosed by mental health professionals, such as eating disorders, high levels of anxiety, or neurodiverse conditions which have high levels of anxiety as a pattern within them. And then from an educational perspective, we might look at the educational provision around children and their families and how that interacts with their ability to engage and their social needs. And so Councillor Cresswell's already mentioned the behaviour management systems that might be in place within a school, and how does that interface with children? How does that get alongside children who have emotional health and well-being needs? And how do we manage the different elements that might need a nurturing approach rather than a hardline behaviour management approach? So this is something that needs careful thought, and this is something which is borne in mind at a whole school approach, and also very much at the individual approach and the family approach. And this is where it's really important that children and families should be at the heart of what we're talking about. If we look at the relationship with special educational needs, some children and their families wouldn't like to be labelled as having special educational needs, and would like to be seen more within a social inclusive model as to how we support them. So I think that that framework is important within our early help planning as that emerges in locality teams. But for now, we do have a very clear structure for special educational needs, and we know that in Plymouth, from the school census, that just under 77% of all children registered as having special educational needs have SEMH as part of their profile. Now that can be also alongside another special educational need, because children who experience other difficulties such as communication interaction or cognition and learning, if those needs are not handled very carefully, they can develop emotional health and well-being needs too alongside that. With the statutory level of special educational need, the more serious level, children who have education, health and care plans, 24% of those are for children who have social, emotional, mental health as their primary need. That's not to say again that that doesn't come into the profile of other areas of SEND. So there are vulnerable groups who are more at risk for emotional health and well-being needs. Children looked after or children known to social workers are a key area, and our virtual school plays an important part in that, in preparing schools through their training for designated teachers, and also every child who is looked after has a personal education plan, and that should incorporate social, emotional, mental health, usually attachment needs as part of that. The other vulnerable group are children who are in danger of missing out on education, and these two things can feed into each other. Children can be in danger of missing out on education for a range of reasons, and that can lead to emotional health and well-being needs, or vice versa. And part-time timetables is an area that is often used as a response by schools to support children, but it needs to be under very strict parameters following government guidance around for how long, and ensuring that safeguarding measures are in place, ensuring that that child is not missing out on education that they can access, and also adhering to a really clear plan with the involvement of external agencies where that's appropriate. So the attendance and welfare service should always be involved. Emotionally based school avoidance is an area where things have usually developed into a more concerning and serious level. And this emotionally based school avoidance is usually where you have a young person who has the involvement of child and adolescent mental health, as well as possibly their educational psychologist. And there is a joint guidance within Plymouth for this group of children prepared by CAMS and the Educational Psychology Service to ensure that these children are regarded as having a special educational need, not just as a child whose family are not sending them to school. So that guidance is something that we really want to ensure that every school picks up when they're looking at the attendance and the non-attendance of certain children. Within that guidance, we have detailed booklets for parents, young children and older children to try and bring them into the heart of this work, because a really detailed child-centred plan has to be taken up for these children in particular. And where we are not successful at getting them back into mainstream school, the alternative and complementary education system steps in and is involved in working in the home and within alternative provision, and always where possible to try to support a return to school. If we look at the reasons for part-time timetables, which are often used as a way of reintegrating children who've been out of school for a long time, it is quite varied. And within our primary schools, 78% of part-time timetables are just labelled as reasons for SEND and behaviour. But within secondary schools, 36% of them are labelled as for reintegration. 24% are labelled as being for medical needs, which can include mental health. 23% for behaviour and 15% for SEND. So there are a number of reasons labelled there, I suspect that when we look beneath those statistics, we'll see relationships across that are related to emotional health and well-being. And the new attendance framework has, as part of its strategy, to look more closely into where that's happening and why. There is a section in the report on the provision to meet emotional health and well-being needs, and the provision spans education, health, and when I say education, I mean schools and also other professionals, other educational professionals within SEND teams. And within health, we have also a range of professionals from mental health support workers within schools as part of the mental health support teams. At the moment, that's in 35 schools, but there is a plan to expand that, as you see further in the report. And as part of CAM's early help, looking towards whole school approaches. The Educational Psychology Service has a termly meeting in every school to look at tracking individual children with SEND as a whole, but also to look at which children are on a part-time timetable and why, and what is the whole school culture. When we say culture, that's going to take some time to change in some schools, but looking at the whole school systems at the moment in each school as to what are they doing for that cohort of children, and are their needs being accurately identified. At the next level, in terms of the graduated approach, what we would have is we'd have a more enhanced assessment and intervention. And within the graduated approach to inclusion, which is on the SEND local offer, there is guidance in there for schools and parents. It shows parents what they should expect of schools. It's a document that they can use to go and discuss with the school what provision is being put in place for their child, and to perhaps challenge where they think that something is not being done. At the sort of the middle point, what we think of as the targeted level, we usually have external professionals involved with the SENCO and the class teacher, and an individual plan for those children. And that can look at developing a more nurturing approach for that child. It might look at more specific behavioural boundaries as well. It might look at support for the family and helping bridge the gap between the family and the school if there is a disagreement there, looking at why. And the Educational Psychology Service has tried to promote a consultation approach which directly involves parents in those conversations about why, about allowing them to show that they are experts on their own children. At the specialist level, we're tending to look more as well for individual children at the education, health and care needs assessment. And at the moment, that's just over 4% of all children in Plymouth. So that is a very specialist level of support. We would want to see far more support going in at targeted and universal levels, with a view to encouraging the support of children within mainstream settings. But at the specialist level, we are then looking at trying to maintain children in the best environment to meet their needs with enhanced support, and developing enhanced review systems, either through their annual review of their plan, but also looking at particularly at transition points, which can be a key trigger for children who rely on adults within the educational setting and their families, children who rely on a team of adults around them who know them really well, who can contain and hold and support them in a positive way. The final part of the report looks at recommendations, and that's in two parts. the recommendations for CAMS are listed. We don't have anybody here from health today, but those recommendations were made at the Mental Health Select Committee here in March, and those are the responses to those. And then we have what's already been touched on, which is the priority actions and the local area inspection recommendations from the inspection, which are described here in broad terms, but which will touch on areas of emotional health and well-being across the partners at the different levels that we've discussed. So at the early help, targeted and specialist levels, but also across the age range. Rachel, is there anything else that you would like to add? I've just given an overview.
My name's Rachel Crozier. Hello, sorry. I'm the assistant head at A Schools and the Senko, and for those of you who don't know, we are the alternative provider within the city. So I think I'm here to provide a kind of practical grassroots reality, if you like, of someone who spends all day every day dealing with children in crisis and directly doing home visits, sitting in meetings. As part of my role, we sit on multiple panels, and I spend a lot of time in other schools, either offering support or consultancy, or sort of helping jointly sort out packages. And I guess I would reiterate what Claire has said, and I think what has been mentioned earlier, there is lots of crossover between emotional health and wellbeing and some of the kind of key priorities and kind of things that have been highlighted through that send Ofsted about, like was mentioned earlier, that continuum of support. All schools are inclusive from an education perspective, but some have more confidence in their inclusion and some are better at being inclusive, shall we say. And I think some of that, for me, in my particular role dealing with schools and dealing with parents, I think confidence and expectations are kind of two clear elements, whether it's parental expectations and parental confidence, and also from schools, their level of confidence at dealing with some of these factors. And that ties in with how they support children with SEND. It ties in with how they support mental health and some of those health aspects. And I think there is still a lot of discussion, I think, about what is a health issue, what is an education issue, how does health support that in relation to education, and how does education support those health issues when they become a barrier to a child accessing education. And I think, like again was said, I think there are lots and lots of elements of really positive good practice, but I think those need sharing, and that kind of collaboration needs bringing together to, rather than look at, I don't know, I guess I work from a practical point of view, politics and systems and frameworks, I am fully understanding we have to work towards them, but actually, regardless of what the agendas are, what the KPIs are, what is in the best interest of that child at that time should, in my opinion, always be at the forefront of all decision making. And I think sometimes it's very easy to kind of get waylaid with conflicting agendas of not just schools but partners, in terms of we lose sight of that. So yeah, I think all of those things kind of have a part to play.
Thank you very much. I have Councillor Beer.
Oh, I'm really enjoying this session. It's one of my babies. I just want to know, I started on the council in 2007, and now 16 years on, I want to know that the CAMS provision that's within this city is easily accessible for young people. So if you have a crisis today, they're not waiting 16, 18 weeks, as they did in 2007 to get that provision. So that's one question. And Chair, may I just zap in with another one? And I wanted to know, is there enough ACE provision within our city? Have you got enough spaces down at Martinsgate to cope with the volume of young people that may be out of education and training?
Can I answer the first? Probably I'll talk about both of those, and my colleagues might want to come in. So the first point was about waiting lists, and I should say that some point our health colleagues would very much like to do a joint presentation. So if there are things you want us to come back with, and this is very much an education perspective, waiting lists were raised, as you'll be well aware, in the inspection report. What I would say is that what was recognised in the inspection report was that while children might not get to see a practitioner for regular appointments very quickly, if there was a concern early on, they would get some input. So while they're on the waiting list, they get some input. So I think that was recognised. I think we would all want waiting lists to be shorter, and it is one of the priorities set out in the plan, and I know something that the health service looks at very closely. In terms of capacity at ACE, as where our partners at ACE do an excellent job. They do have limited physical space at the moment, and with the exclusions, which you'll be aware of, that is being pressured more. So one of the issues is that some of the short-term placements that ACE used to be able to provide some respite therapy for a child who could then go back to mainstream, that those are very much limited now.
Okay, Terry. And I guess following on from that, in terms of CAMS from a practical point of view, as someone who spends her life dealing with CAMS and variety of health services, I think, as Annie said, there are very long waiting lists still if you want specialist input. I think from a kind of narrative on the ground floor, I think there is a lot more being done to try and put early intervention, even if it's as a temporary interim measure, whilst they await more specialist input. I think there are a lot more projects and kind of co-working going on within schools especially. There's been a number of projects to try and co-locate, if you like, mental health specialists within. And I think if you listen to feedback from children, yes, when they get to a certain level, they do need specialist input, but lots of the young people I work with have experienced significant trauma, and actually their key workers who they see all day, every day, are the ones they really want to spend time with, who they really build relationships with. And as much as specialist, psychotherapy or very, very specialist kind of mental health practitioners are positive, actually one appointment with them for an hour every 2 weeks takes an awfully long time to affect significant change and impact for that young person's life. And actually lots of hours don't want to talk to this complete stranger 1 hour every 2 weeks. They want to talk to their key adult who they see every day. And again, I think a lot of that comes back to appropriate funding for schools, about actually allowing school staff who might not be specialist mental health workers but have that relationship with that young person to have the time to give them that input, which I'm we're very privileged. We work with children who are very complex, and we have a lot of very well trained staff, but I think there is still, and it comes back to that kind of level of confidence in secondary schools and in primary schools about, is that a school's job to do that, and how does that fit? Are they trained? And a lot of that comes back to what I think you touched on earlier, is about appropriate training to actually give appropriate staff who have daily contact with these young people the confidence that you can do that. And yes, you do need oversight and training and supervision and some specialist input, but you can do that. And so that's kind of that bit. And then in relation to your second question, we are very busy at the minute on a practical level, and I think the exclusion rates have gone up, and there is lots of work around inclusion to try and reduce those across the city. But I think you end up with that kind of spiralling. The more spaces we offer, the more young people I pick up, and actually it comes back down again to our biggest kind of target audience, whether it's for an SEN child or a child who's going through crisis for a different reason, is about the capabilities of predominantly mainstream colleagues to manage and handle those young people with confidence and with expertise about how to meet their needs. And I think early intervention is all about that. How do we capture them? How do we put in that proper package of support before they kind of get to the stage? So yes, there is a bit of a kind of balancing act, I think, between making sure there's appropriate capacity within us, within special schools, within all of those things. But actually, it's always that balancing act of, but is it in the best interest of that young person to remain within their kind of home school, their local community, their friendship groups, their familiarity, if at all possible? How do we equip schools to better manage, to maintain and sustain that, that's in the child's best interest and in the school's best interest? And I think that ties in with lots of this kind of co-working and lots of that upskilling, I think, of school staff, that there is a crossover between health, between SEM, between education. But how do we help schools navigate that, I guess, within the kind of conflicting agendas that are set by some of the multi-academy trusts, who within the kind of pressure for schools on data, on results, on behaviour, on that kind of ever-widening social deprivation issues that many of them are dealing with. How do we go, but still please try and hold it and do this? Which I'm sure if you had the answers, if any of us had the answers, that'd be lovely. But I think there's the desire to do that, I think.
Chair, can I just suggest we have a recommendation around the CAMS issue, and we deep dive into that a little bit more, because the waiting lists do concern me immensely, particularly if you've got a young person who's in crisis. And although you've talked about early intervention and perhaps stepping in with some help might not be enough. So I'd like to either have that on this panel's agenda or to health. Because I think it's critically important. Because if you're not getting it right for children with regard to their mental health, I just fear the suicide rates will go up, and there are other issues that are concerning me about the length of time it takes to get a CAMS appointment.
That's noted, Terry, thank you. I am going to ask, because we're seriously behind time, if the rest of it, I do have questions on here, but if they are provided via email and a timely response will be written back to you, is that okay? I did want to just make my own recommendation on this, that we write to multi-academy trusts and we ask them how they are working towards the Plymouth plan and driving towards a consistency across all schools and other areas with regard to SEMH. Can that be noted? Thank you. Can I take a vote on that, please? That was unanimous, thank you. Councillor Cresswell.
Could I just make one comment that I think it's been really, really useful having Claire and Rachel here, particularly because of giving that perspective of what it's actually like when you are in the classroom and working with young people and children, and I think that's really important, and we have to keep that at the centre, that every time we are actually talking about individual children and their futures and such, and it's been really, really helpful. And thank you so much for coming and speaking and giving such extensive reports, and also really sharing your both your knowledge and also your passion. So thank you very much indeed.
Thank you, and yes, thank you again. Moving on to item 10, unlocking Plymouth's potential 2023 to 2025. Please can I hand over to Councillor Cresswell to introduce the item before going to Annie Gammon and Tina Brinkworth. Can I also ask that questions be kept brief in this item? Thank you.
Thank you very much. Unlocking Plymouth's potential, I seem to have eaten, slept and drunk this for some time. Unlocking Plymouth's potential neat, seat, eat strategy. Most young people we know actually do succeed in education. They make positive transitions into adult life and the world of work. However, in our city, 1 in 10 young people do not, and this number is unacceptably high. In response, we have developed the city's first strategic plan, which is committed to reducing the high levels of young people not in employment, education or training, NEET. That's the official term that's actually used. I'll change the terms in a moment. Or where their employment, education or training status is not known. We know that spending time in NEET can be detrimental not just to physical health, but also mental health and emotional health, and very much ties in with what we've just been listening to at the moment. It leads to unemployment or perhaps low pay and low quality of work and actual life and even long-term life expectancy. The plan recognises that priority groups of young people will require some additional support and that no single agency can actually address the NEET or youth employment challenge. This groundbreaking plan supports the future of Plymouth's young people to enable them to move confidently in becoming Seeking Employment Education and Training, SEET, so that they successfully transition into adulthood. And I will start to use the term SEET because it's a much, NEET can be a slightly derogatory term. We are actually a trauma-informed informed council, and SEET is a much more positive term to use, Seeking Employment Education and Training. Now, this is all due to the range of factors which has resulted in a young person's ability to engage with education, employment and training. Successful engagement and integration into the labour market, alongside education and training, requires a very strong multi-agency partnership at both a strategic and an operational level, delivering early interventions. Now, some of these young people will require some extensive support with focused, personalised action plans to transition them from being NEET into employment, education or training, into becoming SEETs. We all recognise that the term NEET itself, as I've said, is unhelpful, as it encourages interventions to focus on the symptom rather than the cause or the reason why young people might be disengaged. Transforming our language and using the terminology SEET, Seeking Education, Employment or Training, externally to employers, educators and trainers provides young people seeking employment and education or training, ensures that our interventions focus on actions and support that will ultimately lead to enabling our young people to start on the path to financial independence through employment or in business startups. The plan has been circulated widely through the diverse membership of the Employment and Skills Board, stakeholders with schools and colleges. The consultation process, alongside with wider stakeholders' engagement, has greatly shaped the priorities and interventions going forward. And I'd say finally, it's really important that these young people succeed, and having support, so they might be doing supported internships or supported apprenticeships, means that they are actually being built up in order to succeed and therefore go on, raise their confidence and their long-term prosperity and employment. So thank you very much. I'm going to pass over to Tina now, who will give you a little bit more on the report.
Thank you, Councillor Creswell. I think really just to add, this plan allows us to work across the system, but work in a way where we can move towards a preventative model, so we can really introduce really early interventions to prevent young people from becoming not in employment, education and training. We do know today that our high numbers of NEETs, so 1 in 10 young people, are actually in particular cohorts. So, you know, if you're SEND, only 1 in 2 SEND young people will transition into education training, and very few of those transition into employment. The same if you are a care experienced young person, 1 in 5, and the same if you're in the criminal justice system. So we're looking at interventions to support our most vulnerable and disadvantaged young people. And when we've looked at this across the system, what we've recognised is the early career opportunities, those early employment pathways, don't exist in our city, or existed in very low numbers for these young people. So we've established a SEND employment forum. We've grown the supported internship numbers from 9 to 49. We're working really hard to grow supported apprenticeship opportunities and other innovative pathways which will lead to employment. Thank you.
Thank you very much. Are there any questions? Angela?
Thank you, Councillor Cresswell, and thank you very much. I really enjoyed reading this, and it seemed so well put together, so well thought through, really inspirational. All these additions, what we're going to do, the activities, I read them all through, all the outcomes and the measurements. And then I thought, right, how are we going to do this? And I went back to the second page where it says no direct financial implications, no direct implications on resources. So, you know, given the sort of discussions we've been having today, I just do have to ask, what are your plans to get this done, given it does appear to be a complete, you know, the people who are working as hard as we've had described just now, full-time all the time, have now got to adapt their work plan to get all these systems and outcomes included and embedded in their own plans. So I just wondered what your way of approaching this was going to be. I mean, I'm totally sympathetic. I think it's brilliant. I just think it's, I'd just like to know how it's planned to go ahead.
Would you like to answer that, Tina?
Yeah, absolutely. So I think so it's a really complex landscape. There's lots of people working in this space, but they're operating in silos. So what we're doing is bringing it together in a system approach. So it doesn't need any additional funding because the funding is already there and it's available in multiple guises, whether that's through AUB, whether that's through 16 to 18 provision, whether that's through our EATS transition contracts. The funding is there, but what we don't do is we don't work effectively across the system. So we're bringing it together into the partnership under the Employment and Skills Board to drive this in a more coordinated partnership approach, and just making sure that collectively we're triaging the young people to receive the right support, and through like Skills Launchpad, we are seamlessly hiding the wire to make sure that the young person accesses the support they need. So, for example, to get young people to move from not in employment education into seeking employment education, there's extensive support and wraparound support required, and we just hide that and then triage to the right support. So, whether that's for mental health services, for housing benefits, and other things which may be needed before we can even move the mindset of the young person into seeking employment education and training. So it is a system approach and a more coordinated and joined up approach, maximising all of the funding we already have. And when you map this across the system, there is quite a lot of funding around. I hope that answers your question.
Thank you, Tina.
Thank you very much. Could I just ask that we are kept abreast? I mean, that was really reassuring, but just so that you let us know how it's progressing. Thank you.
If I could just add to that as well, I have to say that Tina and her team are some of the most enthusiastic group of people I think I've ever worked with. And I think when we were talking earlier about the ethos and having this sort of like this can-do ethos, they are people who don't come to me, that old adage, don't come to me with a problem, come to me with a solution. And that team really sums that up, and they are really, really dynamic and are very good at finding funding sources as well.
Okay, thank you. I have Councillor Harris.
Thank you, and thank you for the report. And I'm really, really positive to see the differences. Having worked in this environment and the transition between young people coming out of school or going on for college and into adult education and then into work, I really applaud this because it's really, really needed. My experience is, that children and young people come into further education or opportunities without the skills that they need to be able to work. So their employability skills are not there. They need the confidence, they need to be able to learn how to work, the world of work, and they need support to do that. Having tried to support many young people with CVs, where they have not got any transferable skills. We need to be looking at what floats their boat, what encourages them, so that we can use that like you say about the enthusiasm from Tina and her team, let's use the enthusiasm of the young people and work with them on what their interests are, because if we can start working on their interests, they, you know, they will hopefully be able to then transfer that into vocational work, whether it be through T levels or whether it need to be through supported apprenticeships or work experience, and longer work experiences, not short ones, longer periods of time, so that young people get real support, not just a one-off, 1 week, 2 weeks, which does nothing.
One of the things, just a point about that, and I know Tina will come back to it, but one of the things about that is some of those soft skills, and exactly what you say is that if you put a young person who, say for example, has had an EHCP and they go into an internship or they go into an apprenticeship and they don't have the correct support there, then you're actually building them up for failure. And the last thing you want to do is to do something like that and knock their confidence. And there's a lot of discussion. We've had a lot of discussion about all those soft skills, those skills that you need in order to function and work in the workplace. So yes, very good point taken.
And I think just to add to Councillor Creswell as well, you know, on the back page, you'll see the 5E model, which is a model which we embed into the schools. And this is around embedding employability skills all the way from early years through to post-16. So that's a programme we do with our STEM ambassadors, of which we have over 300 in the city. And we're all working consistently now across the city. So large organisations like Babcock International Group follow this model, and other organisations. So we're really embedding those skills, and we've just run a Your Futures programme, and it was a very small pilot. It was for 4 young individuals, young SEND individuals. One of the young people had been in their bedroom for 2 years and had not come out of their bedroom. And we ran this programme really intensive for 5 weeks. It was a full-time programme and included a residential, which included independent living skills. All 4 of those have now gone on to move from NEET into EAT. 2 of them have gone into part-time employment and are doing some study programmes. 1 has gone to university, and 1 is now doing a work experience programme with a local bookshop. But what was really important about those 4 young people, not only have they're informing us to roll this programme out further, and we've got plans to roll that out to hopefully 80 in the coming year. One of the young ladies who had a quite a serious eating disorder said, "This is, you know, I absolutely feel alive," when she was on her residential, which was, you know, was really emotional for Jane to hear. And also the parents of one of the young men said, "Actually, we didn't expect him to last 1 evening." And when he started that programme, he was really quiet, didn't really speak. And when he finished that programme, he was a different person. He was really, really confident. And he's now secured some part-time work up at the Plymouth Life Centre. So we know these programmes work. We know it's really focused, personalised support, and really drawing out what their passions are and how we can best support them. And we're sourcing funding to try and roll this out on a much wider remit. But so yes, totally agree with everything that's been said.
Thank you. It's always great to hear good news stories. I have 2 people, and then I'm going to close questions. Councillor McClay.
Mine has been addressed, so happy to leave it. Thank you.
Nick. Alison.
Just a very quick one as new councillor. Wonderful positive report. What is a Gatsby benchmark, please? Can you help?
Yeah, so the Gatsby benchmark is how schools are benchmarked around careers advice and guidance and how they embed that into the education system. And schools are rated. And all of our interventions support schools to meet their statutory requirements around the careers advice and guidance. So we're absolutely supporting schools to hit that agenda and targets. So so it'll be really easy for them to adopt.
Thank you very much.
You're welcome.
Thank you, and thank you, Tina. As we are running over time, for the next 2 reports, can we take the reports as read and move straight to any questions, please? So that's item number 11, Children's Services Finance Report and Performance Report. And questions for item 11, Finance Report. Councillor Harrison.
Yeah, sorry. This is sort of a finance report, but it goes back to some of the other support as well. Obviously, we've got quite a large increase with home to school transport. It's, you know, it's a big issue, we know, in terms of because of ongoing costs, but also, you know, young people maybe needing school transport, SEND particularly. How much support do we know is there support happening to help young people become more independent with their travel, so independent travel training, so that we're not needing to use school transport so much?
Annie, would you like to come in there?
That's one of the very questions that that I've asked and we've talked about, and both David and Annie are very, very much into it, because it's really important for young people, not just in terms of the financial savings, but also in ensuring that young people become more independent. So I'm going to pass over to David. It's close to my heart.
I mean, in view of the time and needing to get through the meeting, I mean, I think all I would say is that we have some capacity within the service currently for independent travel training, and recognise that we need to increase that. So part of the plans to reduce our spend on home to school transport and to make the provision better for children, because this is about independence. So the more that children can become independent and travel on their own, then we're skilling them up for life. So it will be one of our strands of the improvement plan around home to school transport, and we will be looking to increase the capacity within the team in order that we can do more.
Okay, any more questions on that? Yeah. Okay, moving on to item 12, the performance report. Could we also note this as read, and any questions for this, please? Moving on to item 13, Plymouth Children's Service Improvement Plan. Please, can I hand over to Councillor Lang to introduce the report before handing over to David Haley?
Thank you, Chair. I was just going to draw your attention to some of the key points in the report with this, which we are doing with our sector-led improvement partners from Dorset, who I think we're really lucky to have them as our sector-led improvement partners. Got absolute faith in Teresa and her team. So this report provides an overview of the progress against the improvement plan. First one is a really important point around the retention strategy for social workers in hard to fill posts, and that includes a retention payment now. So social workers in those teams where there is a retention payment and have been in post for the required time will receive the first payment in their September pay, and the feedback from staff has been positive. Lots of councils do this, and it means people stay with us instead of going elsewhere, and we want, you know, we need a consistent workforce to deliver the improvements that we need to do following this visit, and also in terms of our preparations, in terms of Ofsted coming to do our ILACS inspection sometime soon. We've also agreed to meet the cost of social work registrations for all social workers across the service. Part of the Dorset's improvement work was a real deep dive into how the MASH, the Multi-Agency Safeguarding Hub, so the Council's Children's Social Care Front Door, was working in July. And that really highlighted some urgent work that we needed to do to provide assurance there wasn't any delay for children who were being referred to the MASH. And I have to pay tribute to the teams who worked on the plan following that deep dive, because they were working into the night to address the issues and the problems, and this means now that the MASH is operating in live time. They dealt with the backlogs which were discovered, and with all contacts having an outcome devised within the required 24-hour timescales. And I asked David, I'm updated on this, on the MASH position every Friday. It's an absolute priority that is working the way it should be, because then we will have a positive story around what we have done, improving that area of our work when Ofsted do come and inspect us. And so to support the action that deep dive identified, there's additional management capacity in place, including a new interim head of service and a service manager for the MASH. And I'm going to go and visit the team in the next few weeks as well, so I can see, you know, what floor kind of thing, and see for myself how it's all working. There's work underway to review the partnership threshold guidance with training planned for September and October, and David might want to say a little bit more about how thresholds work and how important it is to get that right, so that the person is directed in the right way when they make their contact with us. Some areas of the service are experiencing really high workloads, and that is a knock-on effect from what was discovered in the MASH. So it's kind of like the bulge is moving along the system a bit, but it's also reduced caseload capacity and vacancies. Plans are progressing to provide additional capacity in the initial response team and the children's social work teams, and that will boost capacity, while newly qualified and overseas social workers are joining us in the coming months. And Councillor Carlisle and I had tea and cake with a number of our new social workers who've joined us from overseas, and we're really happy that they're here, and they seem to be getting on really well. The consultation on the new target operating model has now ended, and a phased plan for introducing the new structure and locality model is being developed, which responds to the feedback that's been received. And part of David's Chief Officer appointment panel, we made it clear that we didn't really want the target operating model to be ripped up and started again, because, as you were talking about senior leadership earlier, you know, we don't want to be unsettling the service, and there are things in the target operating model that we want to achieve. But David also has his thoughts and his input on it. So, and it is definitely responding to feedback around it. But the current improvement plan is being refreshed as well, and it's going to ensure we've identified we need a really clearer focus on the priorities for the next 3 to 6 months, and progress against it will be available for the next scrutiny. We'll bring it back to talk to you about it again. There's an enormous amount of work going on in this area. We can't get away from the fact, as I've said a couple of times, that Ofsted will be coming, and you know, we just really need to be able to tell a really accurate story about how we've worked with Dorset, how we've responded to what they have found, and that we know ourselves and we know how the service is operating. And there has been so much work that has been done, and at the risk of repeating myself, it's hard to believe that David has only been here 6 weeks, because he is really bringing a kind of calm, this is what I'm hearing from all bits of the service, a calm approach to what could be, you know, panic stations, and it isn't. And everybody is getting on board with what needs to happen. And, you know, the Ofsted might be a difficult thing, but actually I think we will have a good story to tell in terms of the improvement work that has been identified by Dorset and by us, and the journey that we're on. Thank you.
Thank you, Jemima. David?
I'm very happy to take any questions that you have from the report. I think Councillor Lang has given a really good overview of the current position as to where we are, but happy to take any more detailed questions on the summary of the improvements that you've got, which is the improvements that have been made across the last month or so, before we transition into a new improvement plan, which will come for thorough review into the next scrutiny meeting. So happy to.
Okay, Councillor Stephens?
Thank you, Chair. In relation to everything that's been discussed today, how do you maintain the emotional health and well-being of the team that has to deliver this and the Ofsted improvement plan and the dovetailing of all the plans that go on and all the work? How do you maintain that? Because I can tell you're working at pace, and you have to tell difficult messages to people, which you've alluded to. But how do you maintain your emotional well-being? And I don't
Well,
mean
let
you
me
personally.
Talk, let me talk, so, in terms of the service, I mean, there are a number of ways. I think, first of all, what I found is that people are really committed and really enthusiastic and determined to bring about the change that needs to be made. And I've set, some expectations in how that works, both internal with our own staff and also with our interim staff. I think that engagement and involvement and ownership has been key to that in the first few weeks. So, explaining to people about why some of the changes need to be made, if there was any doubt about it, and helping people to, really come along on that journey. So I think people have really responded well to the conversations that we've had and the way that I've sort of set things out in terms of how we move forward. And I do think that in order to take people with us on this improvement journey, that that engagement, that ownership, that good communication is really important, and we've got those strategies in place now. I mean, more formally, I have asked the Social Work Academy. Across the country, there are different ways of providing more formal support for particularly social workers and people that are working directly with families for their emotional health and well-being, and they're exploring those models, and we will bring those in more formally so that anyone that wants to access those on a regular basis can. So I think it's a range, and it's about how we go about doing our work as well, isn't it? It's doing it respectfully, it's doing it with support, high challenge, and identifying where people are struggling and helping and supporting them in that place. I mean, just finally in relation to that, we will be increasing capacity in certain areas, as Councillor Langer said, in relation to the recruitment and retention of additional social workers to manage that work coming through. But we're also recruiting and have been successful in 2 out of 5 posts, one of which will start in a week's time and one at the beginning of October, to help us with our programme and project management support. Because what I need is the professional people that know about how to do good social work practice, how to help schools to be inclusive, how to do the professional work, doing the professional work, and the people that can manage transformation, manage programmes, manage projects, doing that work and that working together. So at the moment, because some people left, there is insufficient capacity in that, and the council has supported my recommendation, and there will be at least 5 full-time equivalent posts working within children's services to ensure that we've got all of that running smoothly alongside the professional social work practice.
Thank you very much. Councillor Lang?
Yeah, I was going to talk about the resources work that David has done in this first 6 weeks and identifying a need around business support and making that case and getting those, starting to get those people into the council. In terms of what I've been doing, so Tracy and I have met a group of the chief executive, met a group of social workers and had a very frank and open conversation with them, and actually there was some very, I won't say easy to fix, but kind of there was an issue around parking which has now been resolved. Things like that were kind of niggles that they were very frank and open about, and if we couldn't do something about what they talked about, we said, but Tracy has gone away and solved a few problems that they raised with us. So because we really wanted it to be, we're listening to you and not just a talking shop, but actually go away and sort those things out. And sometimes it's those things at that level that actually make people think, oh, okay, you are listening to us, you are valuing us. Tudor and I met with Tracy, with the heads of service, which was a really frank and open meeting, but it was an opportunity to say a huge thank you to them, because I know how much they're holding in terms of, because they are that level, they are the stability actually in terms of substantive roles, and that was I think a very positive meeting. And yeah, just going back to the idea of stability, I think the more we hopefully I'm not going anywhere. David is acting as if he is the DCS, and the message is around stability, and hopefully that will provide reassurance to the service around, which, your DCS leaving after a year, your service director leaving after not much longer than that. Those are destabilising things, but we absolutely recognise that and are doing everything we can to mitigate the feeling of uncertainty that comes with those kind of things. Thank you.
Councillor McClay.
Thank you, Chair. On page 104, IDs 44 through 47 relates to the percentage of children in care with healthcare checks up to date. I am quite concerned about how low some of those figures are, so I'm just wondering what action plan is being put in place to address those. I know there's some really good work being done in relation to dental, but I'm just wondering about a task force just to push that forward.
Shall I? Can I just take us back to just the three above that, because number 41 and number 42 are positive and both going in the right direction in terms of the short and long stability of placements for children. So that's a good position for the council to be in. It means that the majority of children are in a stable placement. The next one down, 43, is a significant improvement. So my plan is building on that significant improvement. So in May 23, there were only half of the initial assessments which were offered in timescale. There are now 83% of them that are offered in timescale. So that's really, really strong improvement in 2-month period. So it's then building on that in relation to those other three underneath it. So we are working with health colleagues to, the basic question is, so we've achieved that overall in relation to initial health assessments. So how do we build on that and achieve it for those individuals? Now, some of those we have less control over. That's the challenge. So the 83%, we can work with our nurses that are working alongside our social workers, and we can make that difference. As we know, you've just alluded to, the dental, the health checks, etc., are more difficult, but we are working closely with our children's nurses, who here, I have to say, are really well embedded within the service. I mean, they work a lot of the time out of Ballard House. They're sitting with our social work teams within our permanency service. So that's a real strength. They're not at arm's length, and we're having to, so they're working with us to get the right professionals on board to deliver those for children.
Can I just add that this does come up at our corporate parenting board as well, around, we get a regular report around the initial health checks, and yeah, it is, we are improving. But again, it won't be a surprise, but dentistry is really worrying, because obviously our children are facing the same challenges as lots of people in Plymouth are accessing a dentist, but there is work going on to try to address it.
Councillor Harrison.
Thank you. This is page 98, looking at the child in need, child protection and child in care children with missing or incorrect team. I don't really understand what that means, but I am understanding that there's a great big red 5 for July 23, and I wonder if someone could just explain what that means, please.
Yes. Can I bring Paul in, because this is a very data one? Is that okay?
Yeah, it's basically just something that we keep an eye on a regular basis to make sure that the child has an allocated worker on the case. So on that one, we want every child to have someone allocated, and we essentially jump on it the next day. So that number changes every day. We see increases based on things like referrals coming in and a slight backlog, but we do have a colleague that looks at that number every day and contacts the team that owns the child to make sure that a worker is that allocated within 24 hours. It's just something to keep an eye on to make sure that we don't have children that are sort of floating, waiting for that allocation.
So that means that that number, although it could stay at 4 or 5, potentially could be a different child, because the child will be allocated a social worker.
Yeah, essentially, we're pulling that data on the last working day, and rather than not show it, we'd rather say on, Monday morning there were 5 children that were yet to be allocated. Probably by lunchtime they've been allocated. It's just something to keep an eye on, that we always maintain, that we don't want to see that going up and up and up. We want it 0, basically. That's why it's red.
Is that okay? That's all the questions I have. Is that okay? Moving on to item 14, unregistered arrangements. Please can I hand over to Councillor Lang to introduce the update before going to David Haley?
Yeah, I just want to give a bit of context first around unregistered and unregulated placements, because they only happen in extreme circumstances where there's no other provision available. We're reluctant to use them, we're not supposed to use them, but actually I think it's useful to just say a little bit about the placement landscape, not just in Plymouth, not just in the southwest, but across the country. There's pressure on placements, and sometimes the teams, and Emma might want to say something about this, we'll be phoning all day, every day, to try to find an appropriate placement for a child. It's very competitive, it's very expensive. We didn't have any questions on the budget part of the meeting, and I wanted to say something around placement sufficiency, placement cost. Again, not a Plymouth only problem, but it is causing a problem for Plymouth and for Plymouth City Council and for our budgets. And I think that it might be useful for people on this committee to go away and read the Competition and Markets Authority study that they did around children's social care last year. They identified that 80% of, more than 80%, I think 83% of residential provision in this country is provided by private providers. We, as a council, don't have any of our own provision, so we rely on private providers to provide our residential placements. We work with good providers, but it's a provider's market, so we are, I don't think it's too strong a word to say, at the mercy of what they want to charge us, and that also exists in the foster care space as well. We have more children in independent fostering placements than we do in-house placements, and it's an absolute key priority to grow our in-house foster provision, because it's better that our foster carers are our Plymouth City Council foster carers for a whole host of reasons, but one of them is cost. Costs us more to have placements with independent fostering agencies. And again, the market, and it is called a market, which I don't like using that term, but that's what it is dominated by private providers. And I just think it's really important to lay out that context, because I don't feel that the government had an opportunity with the McAllister report to kind of address this, to intervene in that market. And I know you would tick it in the too hard to do box, but actually every council is suffering because of this, because their budgets, there's no way they're going to be going down. They are only going to be heading one way. So I raised it in Cabinet yesterday, and I wanted to raise it here again, because I really feel there's got to be a national conversation. We can't solve this as a single local authority or as a group of local authorities in the southwest, or it's got to be a national conversation about what we do about this. But anyway, going back to unregistered arrangements, which tend to be expensive arrangements, we're reluctant to use them for a whole host of reasons, and primarily we're not supposed to do it, but councils do it, and Ofsted know we're doing it. So all of the children currently in unregulated placements have experienced multiple types of placements, including residential settings that haven't been able to meet their needs. So whilst we continue to search for a regulated placement for each child, which you might want to explain the difference really, but it's an Ofsted approved placement. There's a national shortage of placements, particularly for children with the types of needs that those children have. So we currently have 5 children in unregulated placements, and this is a reduction from 7 in August. And when Sharon Muldoon started as our Director of Children's Services, she made it a priority to get it down from, I think, around 14. So yes, there is a story of improvement there, and it's good, but we shouldn't have any. And that's our ambition. Two of the children have a plan. Two of these children meet the criteria for a secure children's home, but there are more than 40 children nationally waiting on the list. Two of the children have a plan to move to a regulated placement, one in the next couple of weeks. The other child has a placement offer, but no confirmed move-in date as yet. 4 children have deprivation of liberty orders in place that are reviewed by the court regularly. And all children are reviewed by the service director every week, in addition to weekly risk management meetings and visits. So it's not like they are put in these placements and we just go, okay, they're sorted. It's ongoing work, regular work, to try to get them to a regulated placement, which will be the best thing for them. And Ofsted are updated every week on the progress of each child and their plan. And all children are living in short-term rentals in Plymouth and are supported by externally commissioned services with staffing levels that are relevant to their needs. So that's the update around that. Thank you.
David, would you like to?
My only comment would be to reinforce the fact that we are doing everything we can to provide those placements for children which are regulated, because absolutely clearly, to reinforce the point, we do not want any child to be in an unregulated setting. We do enhance and increase the monitoring of those children by social workers and with other professionals, so that we regularly see them and are regularly reviewing their cases. But nevertheless, we want them to be in a regulated setting. And it's probably also worth noting that from the new financial year, from April of next year, all post-16 provision has also got to be regulated. So Emma and commissioning colleagues are now working with all of our post-16 providers to establish what position they're in. Are they going to go for Ofsted regulation? Are they not? If they're not, we then need to make decisions about the children post-16. So that's another big piece of work. And many local authorities, including Plymouth, have got quite a number of children in post-16 supported accommodation, for example. That at the moment doesn't have to be regulated, but it will have to be regulated going forward. So that is another piece of work we're doing, and that's on the horizon for us and for every other local authority.
Thank you, David. Councillor McClegg.
Thank you, Chair. I was just wondering if an action out today could be for the report referenced by you, Jemima, to be circulated to members so we can have a read of citizens.
Noted, thank you. Any further questions? Sorry, Emma, would you like to?
So just a couple of things. One is we are currently coming to the end of a procurement process. As has been made very clear, we don't want to be using these arrangements at all, but while we do, we want to make sure they are as good quality as they can possibly be. So we're currently tendering for a framework list, a list of quality approved providers who can deliver this for us. So at least when we do have to enter into these arrangements, we've set the bar as high as we possibly can. So that's concluding at the minute. My team are leading on that. The other thing is we work very, very closely with our provider partners in the city, and one of them is just this month opening a 2-bed crisis home for us on the outskirts of Plymouth, which we're really excited about. They've worked very closely with us on that model, and we're already thinking about the children that can go in there out of unregulated. A really important thing is, and Councillor Lang touched on it, the cost of this provision, but also for the providers, it costs between £500,000 and £1 million to set up a children's home before you even have a child in there. Because of the rigour of regulation, absolutely rightly, but the setup costs are significant. So it's difficult, it's hard to do, it's expensive, and it can attract some providers with the wrong motivation in terms of seeking profits. We don't want to work with those providers, and we try very hard not to work with those that genuinely have the best interests of our children up their heart. So it's also one other thing, sorry. It's interesting when you look at fostering, independent fostering, there isn't any cost differential between voluntary and community sector providers, fostering providers, and private sector. It's all quite expensive, really. So it's quite interesting. We're not seeing the sort of scales of profits in our fostering providers, but it does cost us significantly more.
Thank you, Emma. Any further questions?
Can I just ask whether is the number of children who are on the list seeking to be fostered stable, increasing or decreasing?
I think I've been here, 15 years now, so a bit long in the tooth for this. I think it's, as a cohort of children in care, it's probably relatively stable. What we've seen is, I think the sector that is struggling the most is fostering, because we are seeing children not being able to be fostered and then going to residential when they don't really need residential. That then means that children who have the most complex needs cannot be cared for in residential because it just pushes everybody up the system. I think it's remained broadly stable. I think what we've seen is more complex needs in fostering, so that's what's made this more challenging. We've got an ageing population of foster carers. We need to be attracting younger, a broader range of foster carers who want to come into fostering, not necessarily all younger, but we really need to be investing, I think, as a country in our fostering sort of culture and supporting people to want to become foster carers.
Alison, did you have a question? No. Is that everybody? Well, thank you very much for today. A few hiccups at the beginning, but we managed to not be too late. Thank you very much for your time today, and thank you, Emma, as always.